Three military helicopters dropped through a thunderstorm at 2:47 in the morning, and the small civilian hospital below had no idea its quiet night was already over. The pilots pushed hard through zero visibility conditions, rotors screaming against the wind, because the men on board were running out of time, and there was only one person on this earth they trusted to stop that clock. Not a general, not a surgeon, not anyone with a title or a corner office. A nurse, a night shift nurse working a 40-bed emergency room in a town most people drove through without slowing down. Her name was Maren Voss, and nobody at Callaway Regional Medical Center knew the first thing about who she really was. Before we go any further, if you're watching this for the first time, hit that subscribe button right now and turn on your notifications, because the story you're about to hear is the kind that stays with you for days. Tap the like if you want more stories like this one. And drop a comment telling me your city and country. I want to see exactly how far this story travels. Now let's get into it. Callaway Regional Medical Center sat on the outer edge of a mid-sized town called Drentwood, tucked between a highway interchange and a stretch of farmland that turned dark and featureless after sunset. It was not a glamorous hospital. The floors were older than most of the staff. The vending machines in the break room ran out of everything useful by Wednesday every week. The ER had 12 beds on a good night, and on a bad night it had 12 beds and 23 patients. Maren Voss had worked the night shift there for 3 years. She was 34 years old, and she did not stand out. That was in some ways the point. She wore the same faded navy scrubs every other night nurse wore. She kept her dark hair pulled back tight. No jewelry, no accessories, nothing that caught the light or invited a second look. She was efficient. She was quiet. She knew where every piece of equipment lived in every supply room on the floor, and she could set up a trauma bay faster than anyone else on shift, and she did it without being asked and without expecting thanks. She was, in the language of the hospital, reliable. Not brilliant, not notable. Reliable. Dr. Garrett Falk had a different word for her. He used it in the break room, not quietly enough, one Thursday evening in early November when he thought Maren was still at the supply station 2 hallways over. She was not. "She's competent," he said to the second-year resident standing next to the coffee machine. "In the way that a well-maintained tool is competent. She shows up, she functions, she doesn't break. You don't have to think about her." The resident laughed, a little nervously, because he had worked with Maren Voss for 2 months, and he had quietly noticed things about her that he didn't entirely know how to explain. The way she called a patient's deterioration before the monitors caught it. The way she looked at a wound and said, without drama, that the attending was going to want to take a second look at the depth because the presentation was inconsistent with what they were treating. The way she was always just slightly ahead of the moment, positioned where she needed to be before the need was officially acknowledged. He laughed anyway. Because Garrett Falk was the attending physician on his rotation, and in a hospital hierarchy, that meant something. Maren heard the word tool. She set down the supply cart she was restocking and stood still for 3 seconds. Then she picked it back up and kept moving. She had been called worse, in places where the stakes of being called worse were considerably higher. Dr. Garrett Falk was 41, board certified in emergency medicine, and the kind of physician who had confused respect earned with respect assumed. He had trained at a well-regarded program in the Northeast, done a fellowship that gave him credentials worth citing at department meetings, and arrived at Callaway Regional 4 years ago with the energy of someone who believed he was doing the hospital a favor by being there. He was skilled, genuinely. On a complicated multi-trauma case, he was fast and decisive, and he did not rattle easily. He was also the kind of skilled that had curdled, slightly, from long exposure to always being the smartest person in the room, or at least, always being told he was. His relationship with nursing staff was functional and cold. He gave orders. He expected compliance. He did not explain his reasoning to nurses because, in his professional worldview, nurses were there to support the physician's decision, not evaluate it. If a nurse flagged a concern, he heard it as a suggestion from someone who didn't have full clinical context. If a nurse flagged a concern more than once, he heard it as a challenge to his authority. Maren had flagged concerns with him exactly 4 times in 3 years. The first time, she had noticed that a patient presenting with what Falk had called a straightforward allergic reaction had a medication list that included a drug that could produce an identical symptom profile through an entirely different mechanism. one that would not respond to the treatment Falk had ordered. She told him, quietly, at the workstation while he was writing the order. He reviewed the medication list, changed the order, said nothing to her. The second time, she had caught a dosage error in a pediatric case. He had been dealing with 2 simultaneous critical patients when the error was written, and it was the kind of mistake that happened in high-pressure multitasking. She corrected it with the pharmacist before it reached the patient. He found out 3 days later through a routine audit. He came to her directly and asked if she had documented the correction. She had not, she said. She had just fixed it. He stared at her for a moment with an expression she couldn't entirely read, then walked away. The third and fourth times were minor. A monitor lead placement issue that was feeding him a false reading. A patient who had mentioned chest tightness while being worked up for a sprained wrist, a detail that had somehow not made it to the front of his chart. Each time, Maren delivered the information plainly, without performance, and moved on. Each time, Falk received it in silence. What she didn't know, what she had no way of knowing, was that he had started to find her deeply irritating in a way he couldn't professionally justify. She had never been wrong. She had never been insubordinate. She had never escalated or gone to charge nurses or department heads. She just noticed things, quietly, persistently. And there was something about the quality of her attention that made him feel, in ways he wouldn't have admitted to anyone, slightly watched. The shift that changed everything started at 7 in the evening on a Wednesday. The ER was running at about 60% capacity, which, for a Wednesday night at Callaway Regional, was almost peaceful. Maren had taken handoff from the day shift charge nurse, reviewed her patients, updated 2 care plans, and was working through a routine medication reconciliation when the paramedics brought in a 47-year-old man named Dale Sumter. Dale had been found on the floor of his garage by his wife. He was conscious but confused, his speech slurred, and he was complaining of a headache that he described, when he could speak clearly enough to describe it, as the worst of his life. Maren was the nurse who took initial vitals. She watched him try to answer the paramedics' orientation questions, and she watched the subtle asymmetry in his face when he smiled at his wife, who had followed the ambulance in her own car and was now standing in the doorway of the trauma bay, with her hands clasped together so tightly her knuckles had gone white. She took his blood pressure. She noted the number. She went to find Dr. Falk. He was in the middle of suturing a laceration in Bay 4, which was routine enough that he could have the conversation without stopping. Sumter in Bay 2, she said, 47-year-old male found unresponsive by family, currently conscious but confused. BP is 198 over 112. Worst headache of his life. Facial asymmetry on the left on smile. Falk finished a suture before responding. What did triage clock him as? Level 3. Keep him on the monitor and I'll get there in 10. Maren stood still for a moment. He described the headache onset as sudden. Wife said it started without warning while he was sitting down. Falk looked up from the suture for the first time. I heard you, Nurse Voss. Level 3. 10 minutes. She went back to Bay 2. She pulled up the standing protocol for neurological emergencies on the workstation and began preparing the supplies for a CT contrast study before anyone had ordered one. She did not do this loudly. She did not announce it. She simply placed the equipment where it would need to be, checked Dale Sumter's IV access, and spoke quietly to his wife about what the evaluation process might involve. 7 minutes later, when Falk arrived and did his assessment and called for an urgent CT because the clinical picture was consistent with a subarachnoid hemorrhage, the supplies were already staged. He noticed. He said nothing. The CT confirmed a ruptured aneurysm. Neurosurgery was called. Dale Sumter was in the OR within 40 minutes of arrival. Later, the neurosurgeon would tell his wife that the speed of the response had made a meaningful difference in the outcome. Falk documented the case. He did not mention the nurse's initial assessment in his note. The incident that Maren never expected happened 11 days later, on a Thursday evening that started slowly and accelerated into something she would remember in precise detail for a long time afterward. A construction crew had been working a site on the eastern edge of Brentwood when a scaffolding collapse brought down 2 workers. The first arrived by ambulance. The second arrived by fire department rescue unit, which meant he had required extraction and had been down longer. Both were critical. The ER went into trauma activation mode, which meant the on-call staff flooded in, the trauma bays were cleared, and suddenly a department that had been managing a Wednesday night patient load was trying to coordinate a two-victim high-acuity response with the attending who had shown up for that shift, Dr. Falk, as the physician of record for both patients. Marin was primary nurse on Trauma Bay 1. The first patient, a 29-year-old man named Kobe Arnett, had an obvious femur fracture, multiple lacerations, and a blood pressure that was dropping faster than they could account for with the visible injuries. Falk was working the airway and calling for imaging while the trauma team moved around him. Marin was watching Kobe Arnett's abdomen. It was subtle, the kind of thing you noticed if you knew what you were looking for. A slight distension, a rigidity in the right lower quadrant when she did the quick assessment, and a bruising pattern on the flank that was developing in real time and shouldn't have been visible this quickly unless there was something happening beneath the surface. "Dr. Falk," she said, "I want you to look at his abdomen. Airway is my priority right now. I understand. The flank bruising is progressing. I think we may have intra-abdominal bleeding independent of the long bone fracture. Noted. Monitor it." "His pressure is falling faster than the femur injury explains." Falk looked up from the airway with an expression that had moved past irritation into something harder. "Nurse Voss, I am managing this patient's airway because if I don't, he will die before we can address anything else. Unless you are capable of managing this airway yourself, I need you to step back and let me work." The room went quiet. Not silent. Monitors kept beeping, IV pumps kept running. The second trauma team was working in Bay 2 and the sounds carried through the partition. But the people in Bay 1 heard it. The second nurse, the respiratory tech, the medical student who was supposed to be observing and had instead gone very still near the supply cart. Marin did not step back. She stepped to the right, giving Falk clear access to the airway, and simultaneously flagged the charge nurse with a look that anyone who had worked with her would have recognized. The charge nurse, a 20-year veteran named Prue Maddox, received the look and moved to the workstation. Marin continued monitoring the abdomen. 60 seconds later, Kobe Arnett's pressure dropped to a level that made the monitor alarm in a way that was not subtle. Falk had the airway secured by then. He looked at the pressure. He looked at the abdomen. "Get me a fast exam," he said. "Now." The ultrasound was already at the bedside. Marin had moved it there while he was working the airway. The fast exam showed free fluid in the abdomen. Significant. The kind that explained the pressure numbers. Falk called surgery. While he was on the phone, Marin was preparing the blood products and the push for the OR. She did not look at him. She was focused on the patient. Afterward, after Kobe Arnett was on his way to surgery, after the second patient had been stabilized, after the department had decompressed from the acute phase, Falk found her at the medication station doing documentation. "I need a word with you," he said, and his voice had the particular flatness of someone who had made a decision before the conversation started. She turned around. "You interrupted a critical airway intervention to push your own assessment," he said. "You were not asked for a differential diagnosis. You were not asked to redirect care. You're a nurse, and your role in a trauma activation is to execute, not to advocate for your own clinical opinions over the attending physician's active decisions." Marin looked at him steadily. "The patient had intra-abdominal bleeding, which I diagnosed. After the pressure dropped. The words were not accusatory. They were simply accurate, and that was worse." Falk's jaw tightened. "I'm filing an incident report. What you did tonight was outside your scope of practice. It was disruptive, and it undermined team function in a critical care environment. You'll be hearing from administration." She said nothing. He walked away. Prue Maddox appeared at Marin's shoulder 30 seconds later, moving quietly, her expression controlled. "I watched the whole thing," she said. "I know. You want me to document my observations?" Marin was quiet for a moment. "Document what you saw, that's all." Prue nodded. "You know what he's going to write in that report?" "Yes." "You're not worried?" Marin turned back to her documentation. "I'm worried about Kobe Arnett's surgery. That's what I'm worried about right now." The incident report landed on the desk of Callaway Regional's nursing director, a precise and unsentimental woman named Dr. Sylvie Okafor, the following morning. She read it twice. Then she pulled Marin's personnel file, which she had not looked at in some time, and read through it carefully. The file was, on its surface, unremarkable. 3 years of employment. Consistently satisfactory performance reviews. One commendation from a charge nurse for exceptional response during a pediatric code 14 months ago. No disciplinary history. No formal complaints. An educational background that listed a BSN from a state university and a prior employment history that read simply United States Army, 6 years, followed by a transition program for veteran nurses. There was no detail about her military service beyond those 6 words. Okafor had processed enough veteran transition hires over the years to know that 6 years U.S. Army with nothing else listed was sometimes intentional. People who had done certain kinds of work often kept it off their formal paperwork for reasons that ranged from modesty to something considerably more complicated. She scheduled a meeting with Marin for the following afternoon. She also scheduled a meeting with Falk. Falk's meeting went first. He presented his account with confidence and documentation. He used words like protocol and chain of command and scope of practice. He was articulate and professionally composed, and he made the incident sound, from his framing, like a nursing staff management issue he had been forced to address. Okafor listened without interrupting. Then she said, "The patient presented with intra-abdominal hemorrhage?" "Yes," "which I identified and managed. The fast exam was already at bedside when you called for it?" A pause. "The equipment was staged." "By Nurse Voss?" "By someone on the nursing staff, yes." Okafor wrote something on her notepad that Falk couldn't read from his chair. "I'll review the documentation from both parties," she said. "In the meantime, Nurse Voss will be reassigned from Trauma Bay primary coverage pending the outcome of the review." Falk nodded. "I think that's appropriate." After he left, Okafor sat for a moment. Then she opened Marin's file again and looked at the 6 words under prior employment. United States Army, 6 years. She circled them lightly with her pen. Marin received the reassignment notice through the hospital's internal messaging system at 4:15 that afternoon, between a tracheostomy patient's care and a discharge summary she was completing. She read it, closed the message, went back to the discharge summary. Prue Maddox found her in the hallway an hour later. "You got the notice?" "Yes." "Are you going to fight it?" Marin thought about this for what felt like longer than it should have taken. "Not right now," she said finally. "Marin, he's wrong. Every nurse on that shift knows he's wrong. I have 3 people who will say exactly what happened." "I know." "So?" "So sometimes you let the process work," Marin said, "and sometimes you know the outcome is going to be the same either way, and fighting it just makes more noise than it's worth." Prue stared at her. "That doesn't sound like someone who fought for anything." Something shifted in Marin's expression then, briefly, and she brought it back quickly, but Prue caught the edge of it. "I fought for things," Marin said quietly, "in places where the cost of losing was considerably higher than a shift reassignment. I know the difference between a fight worth having now and one worth waiting on." She picked up the chart she'd set down and kept moving. Prue watched her go. There was something about the way Marin Voss walked, had always walked, now that she thought about it, like someone who was always tracking the room, like someone who had learned, in some environment that rewarded that particular skill, to know exactly where every exit was. The reassignment took effect the following Monday. Marin was moved to general floor coverage, which meant step-down patients and routine care and considerably less of the high-acuity work she had spent 3 years proving herself in. She did not complain. She showed up at her new assignment with the same efficiency she brought everywhere. The floor nurses, who had mostly heard her name but never worked with her directly, found her easy to work alongside, quiet, competent, no ego attached to any of it. What they also found, within about 48 hours, was that she had a particular quality of attention that was different from the other nurses on the floor. She noticed things. She flagged things. She did it without drama and without any apparent expectation of credit. And the things she flagged had a way of turning out to matter. By Thursday, the floor charge nurse had quietly started consulting her on the patients she was unsure about. On Friday evening, something happened that nobody was prepared for. The call came in through the hospital's emergency line at 9:22 p.m. A multi-vehicle accident on the highway 12 miles east of Brentwood. 7 confirmed injured, 4 critical. Local paramedic units were already overwhelmed. Callaway Regional was the nearest trauma-capable facility, which in practice meant it was the only option. The ER went into mass casualty protocol. Marin was on the floor when the overhead announcement came through. She was in the middle of a patient assessment. She finished it completely, without cutting it short, because the patient in front of her mattered regardless of what was happening downstairs. Then she went to find the floor charge nurse. "I need to go to the ER," she said. The floor charge nurse, a tired-looking man named Royce, who had been at Callaway Regional for 11 years, looked at her. "You're on reassignment." "I know." "Okafor's office sent the paperwork." "I know." Royce looked at the ceiling, then back at her. "If I didn't see you leave this floor, I couldn't stop you, could I?" "No," she said. "You couldn't." He went back to his workstation. Marin was already moving toward the stairs. The ER, when she arrived, was operating at the outer edge of its capacity in ways that were beginning to produce visible cracks. Dr. Falk was there. He was the trauma attending for the evening, which meant this was his call to run, and he was running it the way he ran most things, with loud authority and genuine clinical skill that was, nonetheless, starting to strain under the simultaneous volume. 4 of the 7 incoming patients had arrived. 3 more were en route. 2 of the 4 present were critical and consuming the majority of the senior physician attention. The other 2 were serious enough that leaving them to the residents was not comfortable, but there was no better option. Marin did not announce herself. She walked to the supply station, pulled gloves, and went to the nearest serious patient, a woman in her 50s who had been in the back seat of one of the involved vehicles and had a suspected spinal injury based on the mechanism and was currently being managed with C-spine precautions and a blood pressure that was doing something concerning. The second-year resident managing her looked up when Marin arrived. He recognized her. "She's maintaining," he said, a little uncertainly. "Her pressure is drifting," Marin said, reading the monitor. "What's her fluid status?" 2 liters in. "Is she on any cardiac medications?" He checked the paramedic sheet. "Beta blocker, twice daily." Marin looked at the pressure trend over the last 7 minutes. "She may be unable to compensate the way you'd expect. Her heart rate is masking the picture." The resident's face changed. "Get a blood panel, and I'd want Dr. Falk aware of her pressure trend," Marin said. "She's not safe to leave at status quo." She had already moved to the next bay before he finished writing. She worked like that for the next 20 minutes, not taking over, not commanding, moving through the space, filling the specific gaps that were forming between the available physician attention and the patient needs. She set up equipment. She caught things that were being missed because there was simply too much happening for the available eyes. She said what needed to be said to the people who needed to hear it, in the shortest possible version of the truth, and then she moved. It was not heroic. It was functional. It was the specific skill of someone who had learned to work in environments where chaos was the baseline condition and the measure of success was how many people made it through. Falk saw her. He was in the middle of an intubation when he registered that there was a figure moving through his trauma floor who should not, by his own administrative action, have been there. He finished the intubation, secured the tube, looked up. Marin was 2 bays away, working alongside one of his residents on a chest injury patient, and whatever she was saying to the resident was making the resident move faster and with more purpose than he'd been moving 30 seconds ago. Falk's expression went through several things in rapid succession. He was still in the middle of sorting through them when the radio crackled. Not the hospital radio. A different frequency. The sound came from the parking lot entrance, where a security guard had propped the ambulance bay doors open to facilitate the incoming transfers. And through that door, mixed with the November wind and the sound of approaching sirens, came something that cut through every other sound in the room. Rotors. Not the local helicopter EMS. Everyone on the trauma floor knew that sound. This was different, lower, heavier, the mechanical percussion of something considerably larger than a civilian medevac. One of the nurses near the entrance looked out through the glass doors. "What the?" she started. Marin had gone very still. She was standing in the middle of the trauma floor, gloved hands at her sides, and she had turned toward the sound with an expression that nobody in the room had ever seen on her face before. Not fear. Something harder than fear. Recognition. The first helicopter descended into the parking lot. The second was visible through the glass, coming in low over the tree line. Then the third. Military markings. No civilian paint scheme, no red cross. Olive drab and flat black in the sodium parking lot lights. The rotors hadn't finished spinning down when the doors came open. They came through in pairs, moving with the particular efficiency of people who had trained the chaos out of every transition. 4 of them carrying a stretcher, 2 more flanking, all of them in tactical gear with unit patches that most people in the room would not have been able to identify. The one in front was a big man, early 40s, with the kind of stillness that came from having been in a lot of rooms and being the person responsible for what happened in them. He scanned the trauma floor in 2 seconds, flat. His gaze stopped on Marin. He crossed the room, and he said quietly, in a voice that did not carry further than the 2 of them, a word that was not her name. Phantom. Marin Voss closed her eyes for exactly 1 second. When she opened them, something had shifted, not in her posture, not in her expression, but in some quality behind her eyes that several people on the trauma floor noticed without being able to explain what they were seeing. "What's the situation?" she said. Not a question, a demand. "Arterial," he said. "He's been down 40 minutes. Age, weight, mechanism. 31, 82 kilos, blast proximity, pressure's been cycled twice." Marin pulled off one glove and pulled it back on again, a tight, controlled motion, and said, "Bring him in." The man with the stillness turned to the team and gave a hand signal, and the stretcher came through the doors. Dr. Falk was standing 6 feet away. He had heard the exchange. He looked at the man, then at the stretcher, then at Marin. "Nurse Voss," he said, with the automatic authority of someone who had not yet caught up to what was happening. "You are reassigned. You are not authorized to—" The man with the stillness turned to look at Falk. The look was not aggressive. It was simply the look of someone recalibrating who the relevant people in the room were. "Who are you?" he said. "I'm the attending physician in this emergency department," Falk said, "and I need to know who you are and what authority you have to—" "Captain Drayden Holt, Special Operations Command." The words were flat and fast. "The man on that stretcher has 20 minutes before we lose him. I was told this hospital had someone who could handle this." He looked at Marin. "I didn't come here for a doctor," he said. The trauma floor went absolutely silent. Every monitor still beeped, every pump still ran. But the human noise, the voices, the movement, the ambient sound of people working, stopped. Falk stared at him, then at Marin. Marin was already moving toward the stretcher. She moved the way she used to move, before Callaway Regional, before the faded scrubs and the quiet nights, and the careful business of being someone nobody looked at twice. The hesitation that normally lived in the space between her thoughts and her actions, the civilian overlay she had spent 3 years building into habit, dropped away between one step and the next like something she had set down without deciding to. The stretcher came to rest under the central trauma bay lights, and Marin was already there, already reading him. Not from the chart, there was no chart, but from the body itself, the way his color had gone, and where the movement in his chest was wrong, and the specific stillness of someone whose system had been compensating for long enough that it was running out of ways to pretend. Specialist Tomas Wick was 31 years old, and he had survived things that would not appear in any document accessible to anyone in this room. What he had not survived yet was the last 40 minutes. Blast overpressure at proximity range, Holt had said, which meant the damage was not always where you could see it. Blast injuries lied. They presented clean on the outside and catastrophic underneath, and they killed people who had been cleared by physicians who were looking at the wrong things. Marin had learned that lesson in a place with considerably less equipment than this. "Talk to me," she said to the military medic who had been working him in transit. A young woman, mid-20s, with blood on her sleeve to the elbow, and the controlled expression of someone maintaining professionalism at a cost. "Corman Reyes," the woman said. "I've got 2 large-bore IVs, 1 liter of saline in, pressure's been cycling between 74/40 and 88/52. He was conscious and oriented until about 18 minutes ago. Went unresponsive on approach. Breath sounds? Diminished right side. Started about 9 minutes out." Marin had a stethoscope on his chest before Reyes finished the sentence. She listened, moved the scope, listened again. She looked up at Reyes. "You suspected tension." "Yes, I was about to needle when we landed." "You were right." Marin turned to the trauma bay supply wall, found the chest decompression kit by position without having to look for it because she had restocked that wall enough times to know it in the dark, and said to the nearest nurse, a 3rd year named Becca, who had gone still near the supply cart, "I need you with me. Right side, 2nd intercostal, mid-clavicular line. You've done this before. In simulation, Becca said. Close enough. Watch first, then you'll assist. She had the needle in before Falk finished crossing the room. The rush of air was audible. The pressure gauge on the monitor began its recovery before anyone expected it. Not dramatically, not like the movies made it look, but the kind of slow, grudging improvement that meant they had caught it at the edge of the window rather than past it. Becca exhaled. Marin did not. He needs a chest tube, she said, and I need someone to tell me if we have imaging available or if I'm working blind. Falk had arrived at the bay. He stood at the perimeter of it, not pushing forward, not intervening, and his expression was doing something that his face didn't have a lot of practice doing. Imaging is backed up, he said. Mass casualty protocol, CT is running 2 critical patients ahead of him. Marin processed this without visible reaction. Then we're working from presentation. Reyes, she looked at the corpsman. Was there any external indication of abdominal involvement at the scene? Hard to tell. Gear was on. He didn't report abdominal pain before he went unresponsive. That doesn't mean much with blast. No, Reyes agreed. It doesn't. Marin did the abdominal assessment herself. Rapid, systematic, the kind of palpation that communicated pressure and depth and response in a way that took years to calibrate. She found what she was looking for in the left upper quadrant, where the body's response to what had happened was beginning to announce itself in the language of involuntary guarding. Splenic involvement is possible, she said. Pressure's going to drop again. She said it as a statement of fact, not a prediction, and it happened 40 seconds later, precisely as she said it would. The monitor alarmed. Becca made a sound. Blood products, Marin said. O negative, now. And get me a surgeon on the phone. Captain Holt, who had been standing at the foot of the stretcher with the particular stillness of a man who had been in enough critical situations to know that moving when you weren't useful was a liability, watched Marin work. His expression was not one of someone watching a nurse manage a crisis. It was one of someone watching a specific person do a specific thing that they had seen this person do before, in a context most people in this room could not imagine. Falk was watching too. He was watching from the position of someone who had filed an administrative action against the person currently running his trauma bay, and the specific discomfort of that position was visible in the way he was standing, arms crossed, jaw tight, weight slightly back, the body language of someone who had not decided yet what posture to take. She needs authorization, he said. Not loudly, almost to himself. Holt turned to look at him. From who? Holt said. The next 40 minutes were not smooth. That was the honest version of what happened, and there was no version where it was otherwise, because Tomas Wick had been injured in a way that produced cascading complications, and cascading complications did not resolve cleanly even with the right person managing them. What Marin did, what she actually did, in the specific sequence of decisions and interventions that kept him on the right side of the line, was the product of 2 kinds of experience that could not be separated from each other. The clinical training, which was real and deep, and the contextual training, which was something else, which was what happened when you spent years making these decisions in environments where the resource constraints were severe and the margin for error was 0 and nobody was coming to supervise you. She placed the chest tube. She managed the blood product transfusion with Reyes, who turned out to be genuinely skilled in a way that field training produced in simulation did not, and whose communication was clean and fast and wasted nothing. She coordinated with the surgeon on the phone, a woman named Dr. Paloma Reyes, who was not related to the corpsman and who was currently operating on one of the highway accident patients, but could talk through an assessment, and she caught, during that conversation, a detail in Wick's pressure response that changed her management. The cycling is vasogenic, she told the surgeon, not hypovolemic. He's compensating differently than straight hemorrhagic shock should look. A pause on the phone. You're suggesting neurogenic involvement? I'm saying the pattern doesn't fit straight blood loss. What's his spine look like? I need imaging, and I don't have it yet. Manual assessment? Some asymmetry in the lower extremity response. Right side weaker. Another pause. Keep him flat. If you're right about neurogenic component, you're going to have to be careful with the fluid management. You'll want pressure support without flooding the field. That's what I'm doing. I'll be out of OR in 40 minutes. Don't let him crash before then. Working on it, Marin said, and handed the phone to Becca and went back to the patient. She found Falk still in the bay when she turned around. He was not doing nothing. He had picked up the monitoring responsibilities for Wick's vitals in the background, which was, she recognized, a competent thing to do and a useful thing to do, and he had done it without being asked. She did not acknowledge it directly. She looked at the numbers he was tracking and integrated them into her picture. "What's your read on the pressure trend?" she asked him. Not warmly, not as an olive branch, as a practical question from one clinician to another. He looked at the screen. "It's stabilizing," he said. "Slowly. If the neurogenic component is real, I want to avoid aggressive fluid resuscitation. You agree?" A pause. Falk was a good enough physician to hear the clinical question underneath the moment they were in. "Yes," he said. "Cautious resuscitation, targeted pressure support. Vasopressors if it drops below 70 mean." Agreed. They worked. Not together exactly, and not with the ease of people who trusted each other, but functionally. In the specific collaborative silence of two people who were both, underneath everything else, oriented toward keeping the person on the stretcher alive. Corman Reyes worked with them. She was precise and she was humble in the way that genuinely good field medics were humble, not insecure, but aware of the difference between what she knew and what she didn't, and not trying to paper over the gap. At one point, she looked at Marin across the patient and said quietly, "You trained for this specifically, didn't you? Not just trauma nursing." Marin was checking a line. "What makes you say that?" "The way you move," Reyes said. "I've only seen it in people who've worked austere environments." Marin said nothing. Reyes let it go. "What?" Captain Holt stepped out of the trauma bay at the 30-minute mark to make a call. Nobody stopped him, and nobody could have, but he positioned himself just outside the bay doors where he could see through the glass while he spoke, and whatever he was saying was short and deliberate, and not in a volume that carried. The three other operators from his team had taken positions in the waiting area that were, to anyone looking casually, just people sitting down. To anyone paying attention, they were positioned to see every entrance. The security guard at the desk had noticed. He had called the hospital administrator on duty, a man named Terrence Gable, who arrived at 10:40 p.m. in a jacket he had pulled on over a shirt he had clearly been wearing for casual purposes, and who stood in the waiting room looking at the military personnel and the helicopters visible through the glass doors with the expression of someone assembling a situation they had not been trained for. Gable found Falk in the corridor outside the trauma bay. "What is happening in my emergency department?" Gable said. "Military casualty," Falk said. "Why are they here?" "There are military medical facilities. They requested a specific person," Falk said. The words came out with an edge he didn't entirely control. "Who?" Falk looked at the trauma bay. Through the glass, Marin was visible, her back to them, bent over the patient, working with the kind of focused economy that did not leave room for anything peripheral. "Nurse Voss," Falk said. Gable stared at him. "The nurse you filed the incident report on yesterday." "Yes." "The nurse who is currently on floor reassignment pending administrative review." "Yes." Gable looked through the glass for a moment. "She's in there running a trauma." "Yes." "With military personnel." "Yes." Gable was quiet. Then he said, "Is the patient going to survive?" Falk looked at the trauma bay. "I think so," he said. "If it's going to happen, she's the reason." The administrator absorbed this information with the look of someone doing rapid calculations that extended well beyond medical outcomes. "I need to speak with whoever is in charge of these soldiers," he said. "Captain Holt," Falk said. "He's making calls outside the bay." Gable walked toward the bay, and Falk stayed where he was. He stood in the corridor for a moment that stretched longer than it should have. He was a man who prided himself on clinical clarity, on reading situations accurately, on making the right call under pressure. He was beginning to understand, with the specific discomfort of a slowly arriving conclusion, that his read on Marin Voss had not been accurate in any of the ways that mattered. He did not know what to do with that yet. He went back into the trauma bay. Thomas Wick's pressure stabilized at the 42-minute mark. Not recovered, stabilized. There was a difference, and everyone working him knew it. He was not out of danger. He was in a place where the immediate crisis had been interrupted, which was not the same as resolved, and the surgical team that would need to evaluate his abdominal and spinal injury was still 20 minutes away from being available, but he was breathing consistently. His color had improved from the gray-white of active cardiovascular compromise to something closer to perfused. The monitor, which had been alarming at intervals for the past 40 minutes, went quiet. Marin pulled off her outer gloves and moved to the supply cart. Reyes, on the other side of the stretcher, let out a breath that was not quite a sound, but communicated something she didn't otherwise express. She looked at Marin with the specific look of someone recalibrating an assessment in real time. "Where did you train?" she asked. Not idle. She wanted to know. Marin disposed of the gloves. "Clinical program, then field." "Field where?" Marin looked at her steadily for a moment. "Places that aren't on standard maps." Reyes held the look. Then she nodded, once, in a way that meant she understood exactly what that meant and would not push further. Holt came back into the bay. He looked at Wick. He looked at the monitor. He did a rapid read of the numbers with the competence of someone who had spent enough time in medical environments to know what they meant without being a clinician. "He's going to make it," he said. It was not a question. "He needs surgery," Marin said. "Possible spleen, possible spinal involvement. He needs imaging, and he needs a surgical team, and he needs to not be moved unnecessarily until we know more about the spinal picture." "Understood." Holt looked at her. "Thank you." "Don't thank me yet." "I'm not thanking you for the outcome," he said. "I'm thanking you for being here." Something crossed her face briefly. She turned away from it. "How did you know where I was?" she said. "We've known where you were since the day you left," Holt said quietly. "We know where all of them are." The words landed in the room and didn't settle cleanly because they contained more than the words themselves, and everyone present felt the weight of what wasn't being said. Becca, refilling a supply tray at the side of the bay, was doing an extremely focused job of looking at what she was doing. Falk, at the monitoring station, had gone very still. Administrator Gable appeared at the bay door at that moment, with the expression of someone who had just come from a conversation that had further complicated his evening. "Captain Holt," he said, "I need a few minutes." "Shortly," Holt said. "I need to understand what authority—" "Shortly," Holt said again, and the word was not aggressive, but it was final, and Gable absorbed this and waited. Holt turned back to Marin. His voice dropped enough that it carried only as far as the two of them. "We have a situation," he said, "beyond Wick." She looked at him. "The team we were extracted from is still in the field," he said. "There are 2 more injured. They're being held at a forward position waiting on a medical clearance call before they can move. I need someone to walk me through the assessment remotely so the unit medic can make the stabilization decisions." Marin was quiet for 3 seconds. "What's the connectivity situation?" "Encrypted channel, secure line. I can have it set up in 4 minutes." "What's the unit medic's training level?" "Combat lifesaver. Not a full medic." "So I'm walking a CLS through trauma stabilization on 2 unknown casualties via radio." "Yes." She looked at Wick on the stretcher, looked at Reyes, looked at the bay. "Set it up," she said. "Up." The next part happened in the supply room off the main corridor, which was the only space with adequate privacy and a flat surface, and where Holt's communications specialist, a compact, methodical man named Ozer, who had been silent in the waiting room since arrival, set up equipment that Marin had never seen in a hospital context and did not ask about. The channel opened with the particular static texture of an encrypted line. Not clean, not the way civilian communications were clean, but functional. And on the other end was a young man's voice with the controlled tension of someone working very hard to keep it that way. "This is Calloway," Holt said into the handset. "I have the asset. Go ahead." "Ortega," Holt said to Marin quietly. "He's 23, first deployment." She took the handset. "This is Marin," she said. "Talk to me about your first patient." A breath on the other end. Some relief in it. "Ma'am, I've got Sergeant Bleeker, blast fragmentation, left leg and left side. He's conscious. His pressure was 104/68 10 minutes ago." "How's it trending?" I don't know. I've been managing the other one. Go back to Bleeker. Give me a pressure now." Rustling, the sound of a cuff inflating. 30 seconds. 98/60. Marin did the math. "It's dropping. How much visible blood loss from the fragmentation sites?" "A lot. I packed the wounds." "Good. What did you use?" "Hemostatic gauze on the leg. Pressure dressing on the side." "The side wound, can you characterize it? Entry point, depth?" It's not clean. There are multiple fragments. The gauze is holding, but is he breathing without effort? Yes. Talking to you? Yes, he's awake. He's asking about Castillo. Castillo is your second patient? Yes, ma'am. We'll get to Castillo. Right now, your priority is Bleeker's pressure. I need you to assess his abdomen. Press gently in 4 quadrants and tell me if he reacts. Silence while Ortega did this. Marin looked at the wall. Holt stood near the door. He reacted on the left side, Ortega said. He said, don't do that. That's useful information. Left side fragmentation with abdominal tenderness means we're watching for internal bleeding. Keep him flat, do not elevate his legs, and I need a pressure check every 5 minutes. If it drops below 88 systolic, you tell me immediately. Can you do that? Yes, ma'am. Now tell me about Castillo. What Ortega told her about Castillo was worse than Bleeker, and it was worse in the specific way that certain injuries were worse, not dramatically, not with the obvious indicators that triggered alarm, but quietly. Castillo had been caught in a secondary blast effect and had a head injury he had initially walked away from, which was the most dangerous version of a head injury because it allowed people to underestimate it until the window for intervention closed. Marin worked Ortega through the assessment with the particular patience of someone who knew that the person on the other end of the line was scared and competent and needed both acknowledgement of the first and confidence in the second to do what was required. His left pupil, she said. Compare it to the right. Silence. Ortega. It's bigger, he said. The left one. It's noticeably bigger. Is he still conscious? He was. He's not responding to me now. Marin looked at the wall. Listen to me, she said. I need you to do exactly what I say in exactly the order I say it. Can you hear me? Yes. Good. First thing, she walked him through it. The positioning, the airway management, the monitoring parameters that mattered, and the ones that didn't. She was aware, while she was doing it, that she was doing the thing she had spent 6 years learning to do, translating clinical knowledge into actionable instruction for someone with limited training in a resource-constrained environment, and doing it fast enough that the translation didn't cost the patient time. It was not clean. Ortega made 2 errors that she caught and corrected without raising her voice. The radio connection degraded twice to the point of partial loss, and she talked through the static and waited for it to recover and kept going. At one point, she heard Bleeker's voice clearly on the other end. Tell her she better know what she's doing. And she almost said something but didn't, because Bleeker being irritable meant Bleeker was conscious, and conscious meant she had more time than she feared. He's giving you trouble, she said to Ortega. He's giving everyone trouble, Ortega said, and the exhaustion and the relief in his voice were tangled together in a way that told her he was going to be okay. That's pretty normal for him. Good. Keep him awake and keep him irritable. Irritable is alive. She was 40 minutes into the remote consultation when the door of the supply room opened without a knock. Administrator Gable stood in the doorway. Behind him, looking uncomfortable, was Prue Maddox, who had clearly been pulled into this by someone who needed a nursing supervisor and had found her on the floor. And behind Prue was Dr. Sylvie Okafor, who had not gone home at the end of the administrative day and was still in the hospital for reasons that had nothing to do with what was currently happening, but who had found herself drawn toward the emergency department by the particular instinct of someone who ran nursing operations and needed to know when something unprecedented was occurring in her building. Okafor looked at the communications equipment, at Captain Holt, at Marin, sitting at the supply table with a military encrypted handset, talking a 23-year-old field medic through a neurological trauma protocol in a language that was clinically precise and calmly urgent. She stood in the door and listened for 45 seconds without saying anything. Then she stepped inside and closed the door behind her and shut out the administrator and let Prue in and stood against the wall with the expression of a woman who was revising something fundamental about a person she thought she had understood. Marin did not look at her. Ortega, she said into the handset, give me a pupil update. Left is still dilated, but it hasn't changed further, Ortega said. That's something. How long until your extraction window? 22 minutes. Keep me on the line. Yes, ma'am. Marin lowered the handset for a moment, kept it live, and looked at Okafor. Not with apology, not with explanation, just directly. I'll deal with whatever this means for my employment status when this is finished, she said. Okafor looked back at her for a long moment. "Nobody is discussing your employment status tonight," she said quietly. The handset crackled. Ortega's voice came back with a new edge in it, the kind of edge that happened when a situation changed faster than expected, in the wrong direction. "Marin," he said, and the formality was gone from his voice entirely. Castillo's breathing changed. Something's wrong with the breathing. I can hear it from across the room. Marin was already lifting the handset. "How changed?" she said. "Irregular, slow, not normal slow. Like is it Cheney Stokes? Is it cycling, fast, then slow, then stopping, then fast again?" A terrible pause. "Yes," Ortega said. "That's what it is. That's exactly what it is." Marin looked at Holt. Holt was already moving toward his communications specialist. Because Cheney Stokes' respiration in a blast head injury patient with unequal pupils at a forward position 22 minutes from extraction meant something very specific, and what it meant was that 22 minutes was not going to be enough. "Ortega, listen to me exactly." Marin's voice dropped into a register that was not loud and was not soft. It was the register of someone who needed to be heard through fear without adding to it. "I need you to position Castillo's head at 30 degrees. Do you have anything to elevate with?" I've got a pack, a ruck. Use it. Get his head elevated to 30 degrees now, and tell me when it's done." Shuffling, movement. Marin heard Bleeker's voice in the background asking what was happening, and Ortega telling him to stay down, voice tight. "Done," Ortega said. "Good. Is his airway clear? Can you see his chest moving with each breath?" "Yes, it's still the pattern you described." "I know. The positioning buys us time, not a lot. How is he being extracted?" Holt answered before Ortega could. He had his secondary radio in hand and was already on a parallel channel. "Ground vehicle to LZ, then rotary. Vehicle is 6 minutes out from his position. And from LZ to here? 14 minutes flight if they push." Marin did the math, and did not like the result she arrived at. Cheney Stokes breathing in a closed head injury with blown pupil meant rising intracranial pressure, and rising intracranial pressure without intervention moved along a timeline that did not negotiate. The positioning helped. It was not enough. "Ortega," she said, "does your kit have a needle? A large bore, 14 gauge or larger?" A pause. The sound of a bag being searched. "I've got a 14 gauge angiocath. Do you have a pen light or anything to check pupils again?" "Phone light. Use it. Check Castillo's pupils again right now." Another pause, longer this time. She heard Ortega moving, heard him speaking to Castillo in a low, urgent tone, heard no response from Castillo. "Left is blown further," Ortega said. It's almost fully fixed." Marin looked at the wall. A fixed, dilated pupil in a closed head injury meant the brainstem was being compressed. The brain was herniating against the structures that kept a person alive, and the timeline for that process completing itself was measured in minutes, not in the 20 minutes that remained before extraction arrived. She looked at Holt. "Can your ground vehicle push faster than 6 minutes?" Holt spoke into his radio, listened. 5 if they run dark and push the speed limit. Tell them to run dark and push the speed limit." He gave the order without discussion. Marin lifted the handset again. "Ortega, I need you to stay with me because I'm going to ask you to do something that is going to feel like too much." "Okay." His voice had gotten quieter. Not less controlled, quieter in the way people got when they were preparing themselves for information they didn't want. "The 14 gauge angiocath," she said. "If Castillo stops breathing, I need you to place that needle in the space between his 3rd and 4th knuckle on the right hand." "No, wait." She caught herself. That was a different protocol. She reset. The fear of moving too fast, of compressing the instruction into something a 23-year-old combat lifesaver could execute under pressure in the dark, was something she had to actively manage. Disregard that. "Listen, if his breathing stops completely, I need you to tell me immediately. Not in 30 seconds. Immediately. Can you watch him and talk to me at the same time?" "Yes." "Tell me out loud that you're watching him right now." "I'm watching him right now." "Good. Keep watching. Talk to me about anything. Tell me about Bleeker's pressure." It was a technique she'd used before, keeping a scared medic verbal so they stayed present instead of locking up. Ortega took the instruction and ran with it. He read Bleeker's pressure, 94/62, still dropping but slowly, and updated her on the wound sites and described the environment in spare, functional terms. And while he did all of this, she heard his breathing slow from the hyperventilating edge it had been at earlier into something closer to workable. He was doing well. He was genuinely doing well, and the situation was still bad. In the trauma bay, Thomas Wick had been moved to a monitored bed and was holding his stabilized status with the fragile grip of someone still in danger, but currently ahead of the moment. Dr. Paloma Reyes had emerged from surgery 20 minutes early because her co-surgeon had been able to close, and she had gone directly to the trauma bay, read the chart that Marin and Falk had built together over the preceding hours, and done the assessment with the economy of a surgeon who did not waste motion. She came to find Marin in the supply room. She stopped at the door when she saw the communications equipment, heard the channel, read the situation in approximately 4 seconds. She looked at Holt. "Second casualty incoming," he said. "Head injury, blown pupil." Reyes looked at the supply room table, at Marin on the radio. "How far out?" 12 minutes now," Holt said, "assuming they make the LZ. "What's the presentation?" "Cheney-Stokes. Left pupil fixed and dilated. Blast mechanism. Secondary effect." Reyes was quiet for a moment. "If it's herniation, 12 minutes is tight. I'm aware. I'll need OR space, and I'll need it cleared." She looked at Holt. "Your soldier in Bay 1, Wick. He needs surgical evaluation, but he's not actively crashing. The incoming takes priority." "Agreed," Holt said. Reyes moved toward the door, then stopped and looked back at Marin. "She's the one who's been managing this?" she said to Holt. "Yes." Reyes looked at Marin for a moment with the specific evaluating attention of a surgeon assessing an unfamiliar colleague. "When the patient arrives," she said, "I want her in my OR." Holt said nothing. Reyes said, "Is that going to be a problem?" "No," Holt said. "It won't be a problem." She left. The door swung closed behind her, and the supply room contracted back to its immediate dimensions. The table, the equipment, Okafor still standing against the wall, Prue beside her, Holt near the door, and Marin at the center of all of it, with the radio in her hand. Okafor had not spoken in some time. She had been listening with the focused attention of someone building a picture from component parts. And the picture she was building was revising something she had written in a professional document less than 48 hours ago. The incident report Falk had filed sat in her administrative memory with a different weight now than it had carried when she read it the first time. The ground vehicle made the LZ in 4 minutes and 40 seconds. Marin knew because Ortega's voice changed. The outdoor acoustic quality shifted, the wind picked up in the channel, and she heard the sounds of a transfer being executed rapidly and without wasted motion. "We've got him," Ortega said. "They've got him. They're loading now." "Is he still breathing?" "Yes. Still the pattern." "Still responding to anything?" "No, he's... no response." "Okay. You stay with him on the aircraft. You keep watching his breathing, and if it stops or changes, you tell whoever is on board immediately. Don't wait for permission. Don't defer. You see a change, you say it out loud. Understood?" "Understood." Ortega. "Yeah." "You did well tonight." A silence on the channel. Not a comfortable one. The kind that happened when someone was managing something they hadn't processed yet, and the acknowledgement made it harder to hold down. "Bleeker is stable?" she said, giving him something to redirect to. Yeah, the vehicle's got him too. They've got both of them." "Good. Then you did your job. Stay with them." The channel went to the sound of rotors. Then Holt's specialist took the handset back, and Marin set her hands flat on the supply table for a moment and looked at the surface. Her hands were not shaking. They didn't shake, hadn't for a long time, and she didn't entirely know if that was something to be proud of or something to regard with more ambivalence. She had been around enough people who had the same quality to understand that the absence of visible fear response in high-stakes situations was not the same as the absence of the cost of those situations. She took one breath, controlled, and complete. Then she stood up and looked at Okafor. "Castillo's inbound," she said. "Dr. Reyes wants me in the OR." Okafor looked at her. The expression on the nursing director's face was not the expression of an administrator managing an unauthorized personnel situation. It was something more direct than that. the expression of a person who had needed time to see something clearly and had now seen it. "Go," Okafor said. Marin went. "What?" The second helicopter came in 8 minutes later at a pitch angle that told the people watching from the ambulance bay that the pilot was pushing the airframe harder than standard approach protocol recommended, and nobody said anything about it because everybody could see why. Marin was in the ambulance bay when they brought Castillo through the doors. He was 26 years old. She learned this from the medic on the aircraft, not Ortega, who had stayed with Bleecker, but a flight medic named Asha Tull, who had been running the in-flight management and who delivered the handoff with the compressed efficiency of someone who had done it in worse circumstances. "Pupil blew further on approach," Tull said, moving alongside the stretcher. He had one episode of apnea, 6 seconds, then resumed. "Airway is maintained. No intervention on respirations yet." "BP?" 92/58 on last check, 4 minutes ago." "What's his ICP status?" Marin asked, and immediately knew the answer, which was that they had no way of measuring it in the field, but she asked anyway because the question itself communicated to Tull that she was talking to someone who understood what mattered. "Clinical estimate only," Tull said. "Based on presentation, significant." Dr. Reyes met them at the OR corridor. She looked at Castillo, one clinical sweep of the presentation, the monitors, the color, the respiratory pattern, and made the decision in the time it took to make it. "Or two," she said. "Now, not after imaging." "We don't have a CT," the charge anesthesiologist said from behind her. "I know we don't have a CT. We don't have time for a CT. We're opening on clinical presentation." She looked at her anesthesiologist. "Get him under and get me a burr hole set." The anesthesiologist's expression moved through several things and arrived at professional compliance. "We're doing a field neurosurgery approach in OR2. "We are," Reyes said. "Unless you have a better idea." He didn't. Marin scrubbed with the surgical team. She was not the surgeon, and she was not the anesthesiologist, and there was a clear lane for what she was in this room, which was experienced support with specific operational knowledge of this patient's trajectory, and she stayed in that lane. She stayed in it because it was the right thing to do, and because she understood, with the specific clarity of someone who had spent years working in exactly these parameters, that staying in your lane in a high-stakes surgical environment was not diminishment. It was the thing that kept people alive. Reyes worked with the focused intensity of a surgeon who had made the decision to operate and had placed everything non-surgical in a room she had mentally closed. She explained her steps in the sparse procedural language of someone thinking out loud for the benefit of the team. "Burr hole, right side temporal," she said. "If we've got herniation, I want to decompress the fastest route." The anesthesiologist had Castillo under with the speed of someone who had recalibrated the stakes. "He's stable on induction. BP is holding. Tell me if it doesn't." "I will." Marin watched Reyes work and tracked the monitors and anticipated the needs. Suction before it was called for, retractor position, the sequence of instruments that the procedure required, and the scrub tech, who had been in that OR for 6 years, noticed within 3 minutes that the person across from the surgeon was not working from a standard surgical nursing background. She was working from something older and more contingent than that. She didn't say anything. She adjusted her own rhythm to accommodate it, and they found an efficiency that the situation needed. The decompression produced drainage. "There it is," Reyes said, and the words were not triumphant. They were the words of someone confirming a clinical hypothesis in the most consequential possible way, the relief in them indistinguishable from the grimness because both were true at the same time. The drainage was the hemorrhage, the pressure that had been building inside Castillo so now, and going somewhere was different from having nowhere to go by a margin that was the margin between alive and not. "BP's coming up," the anesthesiologist said. Marin watched the monitor. 88/54, then 94, then 101. "Pupil response?" Reyes asked. The anesthesiologist checked. "Left is still fixed, but the right is reactive." "That's something," Reyes said. "It is," Marin said quietly, and Reyes looked at her across the surgical field with an expression that was, in the context of where they were and what was happening, the closest thing to acknowledgement available. The surgery took an hour and 40 minutes. When Reyes closed, Castillo was alive and the monitors showed a patient who had come back from the edge of the specific cliff that blast head injuries produced. He was not out of danger. He would not be out of danger for days, and the long arc of his recovery was something nobody in the room could predict. But he was alive in a way that was sustainable, and that was what had been at risk. Marin walked out of the OR at 1:17 in the morning. The corridor outside was quieter than the night had been at any point in the preceding hours. The highway accident patients had been admitted, stabilized, or transferred. The ER had decompressed. The military personnel were distributed between the waiting room, the trauma bay where Wick was being monitored, and the loading area where the helicopters sat grounded for the night at Holt's direction. Falk was in the corridor. He was sitting in one of the chairs outside the surgical suite, which was not a place he had any administrative reason to be. And when Marin came through the OR doors, he stood up. He had clearly been there for some time. His posture had the settled quality of someone who had waited longer than they expected to. She stopped. He looked at her. He looked at the dried antiseptic on her forearms where the gown had not fully covered, at the fatigue that was visible now in the set of her shoulders in a way it hadn't been during the active work, because during the active work there was no room for it. He said nothing for a moment. Then he said, "Castillo made it." "Yes," she said. "Wick is holding." "I know." Another pause. Falk looked at the floor, then back at her, and the expression on his face was not comfortable for him to be wearing. It was the expression of a man in the middle of revising something about himself that he had been carrying for a long time as a certainty. "The incident report I filed," he said. She waited. "I'm going to withdraw it." She looked at him for a moment. "That's your decision." "I know it's my decision. I'm telling you I'm making it." He paused. "What you did tonight. What you've been doing, I think, for longer than tonight. I didn't see it. I wasn't looking for it. That's on me." "Dr. Falk, I'm not asking for anything," he said. "I'm not looking for you to say it's fine. I know it's not fine. I needed to say it." She studied him. There was something genuine in it, and she was a person who had learned, in environments where reading people's authenticity mattered considerably, to tell the difference between genuine and performed. He was not performing. He was, in the specific, uncomfortable way of someone who had arrived at a conclusion they didn't enjoy, being honest. "Okay," she said. "Okay?" He seemed slightly wrong-footed by the brevity. "You said what you needed to say," she said. "I heard it. That's what this is." She started down the corridor. He watched her go. Then he sat back down in the chair and put his face in his hands for a moment. Not dramatically, just the gesture of someone releasing something they'd been holding. And the corridor was empty enough that nobody saw it. Captain Holt found Marin at the nurses' station, where she had stopped to document the events of the evening in the clinical record with the methodical thoroughness of someone who understood that the record mattered regardless of everything else. It was nearly 2 a.m. and the station was quiet except for the night shift nurses running their standard monitors. Holt sat down in the chair beside the station without asking permission and without preamble. "I owe you an explanation," he said. Marin kept typing. "You don't owe me anything." "Not about tonight, about why we came here, to this specific hospital." She stopped typing. "You knew where I was," she said. "You said that." "Yes." "That implies someone made a decision not to make contact before tonight." "Yes," he said again. "So why tonight? Why this situation?" Holt leaned forward in the chair, elbows on knees, in the posture of someone choosing their words with more care than their casual bearing implied. "There's a review," he said. "It started 6 weeks ago. An inquiry into the operations your unit ran during the last 18 months of your deployment. Someone has decided, at a level above my authorization to discuss, that certain decisions made during those operations need to be formally examined." Marin had gone very still. "What kind of examination?" she said. "The kind that involves testimony," Holt said, "from people who were there." "I've been out for 3 years." "I know." "I left the unit. I left on good terms. I completed my separation correctly. I have been a civilian for 3 years." "I know all of that," Holt said. "None of it changes the inquiry." She looked at the monitor in front of her without seeing it. The fluorescent lights of the nurses' station were humming at a frequency she had never noticed before and was now completely aware of. "Who initiated it?" she said. Holt was quiet for a moment. "That's the part I'm not authorized to tell you. Not because I'm withholding. I genuinely don't have the full picture. What I know is that it came from outside the unit, outside the direct chain." "How far outside?" Far enough that it came with paperwork that made the colonel uncomfortable, and I have never seen that man uncomfortable. Maren sat with this information for a moment. Sat with what it meant that Holt had come to her, specifically, on a night when he had a legitimate operational reason to be here, a wounded soldier who needed her expertise, but that the conversation they were now having was not about the soldier. "You needed to see me," she said slowly. "Wick was real. Castillo was real. But you also needed to see me before the inquiry found me first." Holt met her eyes. "Yes." "To tell me what?" "To tell you that there are people in that inquiry who are not interested in the truth," he said. "And to tell you that the people who served with you, the people who were there, are not going to let that stand." The night shift nurse at the far end of the station answered a call light and moved away down the corridor, and the station became quieter. "There's something else," Holt said. Maren looked at him. "The officer who initiated the inquiry," he said. "His name is Colonel Marcus Draven. He was the oversight commander on the third operation, the one that went—" "I know which one," Maren said quietly. "He's reframing the record. He's claiming the medical decisions made on the ground during the extraction were unauthorized departures from protocol. He's arguing that those decisions put the mission in jeopardy." She was completely still. "The decisions that saved 11 people," she said. The words were flat. Not a defense, a statement of what happened. "Yes. He's arguing that saving 11 people put the mission in jeopardy. He's arguing that the methods used were outside authorization. He's building a case that the person responsible for those decisions, for the call to stop the extraction and treat in place, acted without command authority." She heard what he wasn't saying. The person responsible. Her. "If the inquiry finds against me," she said, "what does that mean?" Holt was quiet for a long moment. Long enough that she had her answer before he gave it. "It means your nursing license could be reviewed," he said, "on the grounds that actions taken under military authority and subsequently found to be unauthorized demonstrate a pattern of acting outside defined scope." The fluorescent light kept humming. Maren looked at the nurse's station, at the monitor, at the clinical record she had been documenting, the careful, thorough, by-the-book record of tonight's events, the record that showed a nurse working within her clinical knowledge and her training and the boundaries of what was appropriate. She looked at it for a long time. "Who else knows about the inquiry?" she said. "Right now, the inquiry board, the colonel, me, and the 2 officers who served with me on the original extraction. And now you. And if the inquiry moves forward on Draven's framing, it goes to a military review board, and then, if they refer it, to a civilian licensing authority." She turned to look at him directly. "He's using military process to get to my civilian license," she said. "Yes, because the civilian license is the thing that matters now. It's what he can actually take." Holt held her gaze. "Yes." Outside in the parking lot, through the glass doors at the end of the corridor, one of the Blackhawks was visible in the lot lights. Rotors still, the aircraft grounded for the night. 3 years ago, she had ridden in aircraft like that to places that did not appear on public maps, and she had made decisions in those places that she would make the same way again if given the same information and the same circumstances and the same 11 people bleeding on the ground. She would make them the same way. She was certain of that. She was also certain that Colonel Marcus Draven knew that, and that his inquiry was not designed to find out what had happened. It was designed to make what had happened into something else. "I need to know everything you can tell me about the inquiry board," she said. "Composition, timeline, what documentation Draven has submitted." "I can give you most of that," Holt said, "and I need to know if any of my unit members have already been interviewed." "2 have," he said. "Both declined to provide statements consistent with Draven's framing." "Which means they're now also in his sights." "Potentially." She stood up from the nurse's station chair. The night shift had several more hours to run, and she was technically still on assignment to the general floor, and the emergency department had been managed through the crisis, and there were 100 practical things that described what the next few hours looked like. None of them were what she was thinking about. She was thinking about the third operation, about the mountain pass and the temperature and the 11 people and the decision she had made in 40 seconds with the information she had at the time, about the aftermath, which she had never fully processed because processing it would have meant sitting still with it, and for 3 years she had made a deliberate choice not to sit still with it. She was thinking about Colonel Marcus Draven, who had been on a screen in a forward operations center 40 miles from the mountain pass when those decisions were made, and who had said nothing in the immediate aftermath, had, in fact, signed the paperwork that closed the operation as successful. 3 years later, he was calling those same decisions unauthorized. Something cold and clear settled into the center of her chest. Not anger. Anger was loud and imprecise, and she had no use for either quality right now. Something older than anger. The thing that had kept her functional in the mountain pass when the temperature was dropping and the blood wasn't stopping and there was nobody coming to authorize anything. "Holt," she said. "Yeah." The 2 unit members who declined to provide statements consistent with his framing. "I need their contact information." "I'll get it to you. And I need a copy of whatever documentation Draven has submitted to the inquiry board. Whatever you can access." "I can access some of it." "Get me what you can." She started down the corridor toward the ER, because the night shift was not over, and there were patients who needed care, and she was a nurse, and that was what she did. Behind her, Holt watched her walk and thought about the mountain pass, and the 11 people, and the 40 seconds, and the woman who had made the call that everyone at the time understood was the only call available. He pulled out his phone and started the message that would reach the 2 unit members by morning. What he did not yet know, what none of them yet knew, was that Colonel Draven's inquiry was not operating in isolation, and that the paperwork it had generated had already reached a second desk in a second office, belonging to a person whose involvement would change the entire shape of what was coming. And that person had already made a phone call, and the call had already been answered. The call that had already been answered belonged to a woman named Brigadier General Sylvia Marchand, and she had been awake when it came in at 11:47 p.m. because she was almost always awake at 11:47 p.m., which was a quality of her life she had stopped apologizing for sometime around her 52nd birthday. She was the head of the Judge Advocate General's Investigative Division for the Eastern Regional Command, which was a title that meant, in practice, that when military inquiries produced paperwork that smelled wrong, it landed on her desk before it landed anywhere else. Colonel Draven's inquiry had landed on her desk 6 days ago. She had read it twice, set it down, and made a note to herself that she would need to understand the third operation considerably better than the inquiry's framing allowed. The call that came in at 11:47 was from a name she recognized, a legal officer attached to Holt's unit, who had served as documentation witness on several operations, including the third one. And what he told her in 7 minutes of careful, specific language was that Captain Holt had made contact with the subject of the inquiry, that the subject had spent the night saving the lives of 3 soldiers, including 2 who had come directly from a field situation, and that the documentation of tonight's events at Callaway Regional Medical Center was going to be, in his professional assessment, highly relevant to the question of whether the inquiry's core characterization of the subject had any basis in observable reality. Marchand listened without interrupting. When he finished, she said, "How many witnesses to tonight's events?" "Hospital staff, military personnel, the administrator, 15 minimum." "Any of them going to have trouble with their recollections?" "No, ma'am." "Is Holt going to be available for a deposition?" He said yes before I finished asking. "And the subject herself?" A pause. "I didn't ask her directly, but based on what I observed tonight, I'd say she's not going to run from it." Marchand set down her pen. "Get me the full operational record for the third extraction, not Draven's version, the original field documentation, whatever the unit filed in the 72 hours after the operation." "I can have it to you by morning." "Have it to me before morning," she said, and ended the call. She sat for a moment in her office, the kind of office that accumulated paper because the work was the kind that generated paper, stacks of it, the documentary evidence of decisions made under pressure by people operating in conditions that paperwork could never entirely capture. She thought about Colonel Draven. She had known him for 11 years, which was long enough to know that he was the kind of officer who managed his record the way some people managed their appearance, with constant attention and without mercy for anything that complicated the picture he wanted seen. He was not stupid. Stupid officers were easier. He was selective, and selective in ways that had served him well across a career built on being present for successes and absent from failures. And the third operation had been, from his vantage point 40 miles away on a screen, the kind of ambiguous outcome that his record management instincts would have filed under potential liability. 3 years of filing it under potential liability, and then something had changed. She didn't know yet what had changed. She intended to find out. Maren finished her shift at 7 in the morning. She had worked through the remaining hours the way she worked through everything, without performing the weight of what had been said to her, without letting it alter the quality of her attention to the patients in front of her. A man with chest pain who turned out to be a panic attack that he was embarrassed about. An elderly woman with a UTI who kept apologizing for bothering them. A teenager with a wrist fracture who wanted to know if he could still play in the regional qualifier next week. And Maren had looked at the x-ray and said, probably not this week. And the kid had looked at the floor and she had said, but the week after that is a different conversation, which made him look up. She did these things. She documented them. She did them well. At 7:15, she was in the break room with her bag and her jacket and a cup of coffee she had poured without remembering pouring it. And Prue Maddox came in and sat down across from her without preamble. Talk, Prue said. I'm fine. That wasn't what I said. Maren looked at the coffee. There's a military inquiry. It involves decisions I made during my last deployment. Someone is trying to use it to reach my nursing license. Prue absorbed this without visible reaction, which was one of the things Maren had always respected about her. Who? A colonel named Draven. He was oversight command on the operation. He's framing decisions I made in the field as unauthorized departures from protocol. Were they? I made the call to treat in place instead of continuing extraction, Maren said. 11 people were bleeding in a mountain pass and moving them would have killed at least 4 of them before we reached a medical facility. I stopped the extraction and managed them on site until we could safely transport. And that saved them. Yes. And he's calling that unauthorized. He's calling it a unilateral decision made outside command authority. Prue looked at her steadily. Were you given command authority in that situation? I was the senior medical person on the ground. That's not the same as what I asked. Maren met her eyes. In that unit, in that situation, with communication compromised and casualties deteriorating, yes. The authority to make medical decisions was mine. That's what the structure was. Is that documented? It was documented in the original field reports. Whether Draven's inquiry version of the record reflects that is a different question. Prue was quiet for a moment. Okafor knows about the inquiry? She heard what Holt told me. She's going to want to talk to you before you leave. I know. Maren. Prue leaned forward slightly. Whatever he's trying to do, this colonel, he came here last night and his soldiers needed you and you did what you do. All of us saw it. That matters. It matters to me, Maren said. I don't know yet if it matters to a military review board. Then we make it matter, Prue said. Maren looked at her. Prue Maddox had 20 years in emergency nursing and a way of saying things without ornamentation that Maren had always found more useful than comfort. You can't be a witness to a military inquiry, Maren said. I can be a witness to what happened in my emergency department, Prue said. And so can 11 other people on last night's shift. And so can Dr. Reyes. And so can the administrator who watched you save a soldier that military medicine couldn't get to in time. She paused. You spent 3 years being the person nobody looked at. Last night, everybody looked. Use it. Okafor's office at 7:40 a.m. had the quality of a room in which a significant decision had already been made, and the meeting was to communicate it rather than arrive at it. She was behind her desk when Maren came in. Falk was there, which Maren had not expected, sitting in one of the 2 chairs across from the desk with the posture of someone who had also been summoned rather than invited. He looked like he had not slept, which was accurate, because he hadn't. Maren sat in the second chair. Okafor looked at both of them. I'm going to say this once, she said, so I want you both to listen completely before responding. She folded her hands on the desk. Last night, this department managed a mass casualty event from a civilian accident while simultaneously receiving and treating 3 military casualties, one of whom required emergency neurosurgery without imaging, and 2 of whom were stabilized remotely via radio consultation. All 5 patients are alive this morning. The clinical decisions made during that period were appropriate, skilled, and in several instances exceeded the standard response available from the staffing on shift. She looked at Falk. The incident report filed against Nurse Voss will be withdrawn, she said. I've already contacted the department head. The withdrawal will be documented as initiated by the filing physician in light of subsequent clinical evidence. Falk nodded once. I've already drafted the withdrawal. I know. I received a copy at 6 a.m. Okafor looked at Marin. Your personnel file will be updated to reflect the events of last night, documented by Dr. Reyes, Captain Holt, Corpsman Tull, and myself as witnesses. You'll be restored to Trauma Bay primary coverage effective your next shift. Marin said nothing. Additionally, Okafor said, I received a call this morning from Brigadier General Sylvia Marchand of the Judge Advocate General's Investigative Division. The room went still in the specific way of a room in which the stakes have just changed shape. She is requesting access to hospital records from last night's events as supplementary documentation in an ongoing inquiry. I've authorized that access. I've also offered to provide a formal statement from this institution regarding your clinical performance. Okafor paused. I want you to know that offer was not contingent on being asked. Marin looked at the desk for a moment. When she looked up, her expression was not what Okafor expected. Not relief, not gratitude. The emotions that the moment seemed to call for. It was something more contained than that. The expression of someone who had spent a long time not expecting institutional support and was calibrating how to receive it. Thank you, she said. Don't thank me for doing what's accurate, Okafor said. She looked at Falk. You want to say something? He did, clearly. He had been sitting with it since he came into the office. I want to say that I made assumptions about Nurse Voss that were not based on evidence, he said. They were based on hierarchy, on a model of how the department should function that I'd stopped questioning. He looked at Marin directly. You were right about every patient, every single one. I knew you were right, and I made it about authority instead of about the patient, and people could have been hurt because of that. The room held the statement. People weren't hurt, Marin said. That's not because of anything I did. No, she said. It's not. It was not an absolution. She was not in the business of absolutions. But it was honest, and he received it the way someone received a fair assessment, not comfortably, but without flinching. The original field documentation from the third operation arrived on Brigadier General Marchand's desk at 5:47 a.m. in a secured digital transfer from the unit's records officer, and she read it for 2 hours before her first scheduled meeting of the day, with the focused attention of someone looking for the specific gap between two versions of the same events. She found it. It was not subtle once you knew to look. The original field reports, filed by Holt, by the unit's 2 senior NCOs, and by the medical officer who had been on the extraction team, described the communication breakdown in the mountain pass with consistent specificity. The timing, the nature of the breakdown, the duration of the window during which the unit was operating without contact with Forward Operations Command. During that window, the senior medical decision-maker on the ground had made the call to treat in place. The original reports did not describe that call as unauthorized. They described it as the correct application of the unit's medical authority protocol, under which the senior medical person on the ground held autonomous decision-making authority during communication compromise situations. They described it as the decision that saved 11 lives. Draven's inquiry document referenced the same events and described the same decision as a unilateral departure made without command authorization. And crucially, it omitted the communication breakdown entirely. In Draven's version, communications had been degraded but not broken. In Draven's version, there had been a window during which command could have been reached. Marchand read that section 3 times. Then she pulled the signals intelligence log from the operation, the technical record of communications status, maintained automatically by the unit's equipment and not subject to narrative interpretation, and looked at the timestamp data. The communication window that Draven's inquiry implied had existed did not appear in the signals log. What appeared in the signals log was a 17-minute complete blackout, beginning 4 minutes before the medical decision was made and ending 11 minutes after. There had been no window. The decision had been made exactly when the protocol said it should be made, during a documented communication blackout, by the person the protocol designated to make it. Marchand set down the signals log. She picked up her phone and called the legal officer who had reached her the previous night. I need to know when Colonel Draven last accessed the unit's operational records archive, she said. I can find that out. Find it out quickly. She set down the phone and looked at the signals log again, and the specific coldness that she brought to situations that involved the deliberate misrepresentation of documented fact settled into her professional bearing. Draven had not made an error. Errors were recoverable things, the product of incomplete information or honest misinterpretation. What she was looking at was a constructed narrative, and constructed narratives had authors who made choices, and choices left traces, and traces were what her division existed to follow. The call came to Marin's cell phone at 2 in the afternoon while she was at her kitchen table with Holt's secured document package and 3 years of her own memory, building the parallel record of the third operation that she should have built 3 years ago and had not built because she had spent 3 years trying to put the third operation somewhere she didn't have to look at it every day. The number was unfamiliar. "Voss?" she said. "Nurse Voss, this is Brigadier General Sylvia Marchand, JG Investigative Division. I'd like to speak with you about the Draven inquiry." Marin set down her pen. "I've been expecting this call." "I imagine you have," Marchand said. "I want to be direct with you about where things stand. I've reviewed the original field documentation from the third operation. I've reviewed the signals intelligence log, and I've reviewed the inquiry document that Colonel Draven submitted." "And they don't describe the same events," Marchand said. "The discrepancy is not minor, it's structural." Marin was quiet. "I need your account of the third operation," Marchand said. "Your direct account, in as much specific detail as you can provide. I can take a formal statement, or we can begin with a preliminary conversation. Your choice." "What does the preliminary conversation protect and what does it not protect?" "It's not on record. Anything you say in a preliminary conversation informs my investigation, but cannot be used as testimony." "And the formal statement?" "Is on record and can be entered as testimony in any subsequent proceeding." "I want to give the formal statement," Marin said. "I don't want a preliminary conversation. I want what I say on record." A pause. "That's an unusual choice for someone in your position." "I know what I did in that mountain pass," Marin said. "I've known it for 3 years. I'm not interested in saying it in a room where it doesn't count." Another pause, slightly longer. "I can arrange a formal statement session for tomorrow morning if you're available." "I'm available. I'll send you the details." Marchand paused once more. "Nurse Voss, I want to ask you something that isn't part of the formal process." "Go ahead." "Did you know, at the time you made the decision to treat in place, that you were operating within the documented authority protocol?" Marin looked at the papers on her kitchen table. The signals log that Holt had gotten her. The unit's medical authority protocol, which she had printed from the secured archive, and which had not changed in the years since the operation, and which said, in language that was not ambiguous, exactly what she had always known it said. "I knew," she said. "I always knew." "Then why didn't you make that case immediately, when the operation was reviewed?" It was the question she had asked herself. The honest answer was not simple. "Because I was tired," she said. "I had been operating in austere conditions for a long time, and I was tired in a way that went past sleep, and when the operation closed and the review said successful, I made the decision to leave. I chose a quiet hospital in a town most people drive through without stopping, and I chose to be someone that nobody looked at." She paused. "I thought I was done." "You weren't done," Marchand said. "No," Marin said. "I wasn't." "What?" The legal officer called Marchand back at 4:15 with the information she had requested about Colonel Draven's access to the operational records archive. He had accessed the archive 14 months ago. 7 months after that, he had accessed it again. The inquiry document he submitted bore a filing date 3 weeks prior to Marin's conversation with Holt. 14 months of construction, 7 months of refinement, 3 weeks since he pulled the trigger on it. Marchand brought this information to a meeting that afternoon with 2 members of the inquiry board, a meeting that Draven was not attending and did not know was occurring, and presented the signals log alongside Draven's inquiry document, and let the discrepancy do what discrepancies did when placed in front of people who were paid to understand their significance. The senior board member, a colonel named Fassbender, who had 26 years of service and the specific exhaustion of someone who had spent those years dealing with exactly this category of institutional problem, read both documents without speaking for 8 minutes. Then he said, "The signals log is authenticated?" "Independently verified this morning," Marchand said. "The log is generated automatically by unit equipment and is not subject to manual entry or modification. And the inquiry document omits the blackout entirely." "Entirely." Fassbender set the documents down. He looked at the second board member, a woman named Lieutenant Colonel Rice, who had been quiet through the presentation and whose expression communicated that she had arrived at her conclusion before Fassbender finished his sentence. "This needs to be escalated," Rice said. "I know," Marchand said. "I need authorization to expand the inquiry." "Expand it how?" "I need to examine Draven's records access history across the full archive, not just the third operation. If he's done this once with a specific intent, I need to know if this is the first time." Fassbender looked at her. "You're suggesting a pattern." "I'm suggesting the evidence warrants the question." He was quiet for a moment. "You'll have your authorization by end of day." Draven learned that the board meeting had occurred without him at 6 p.m., when his aide received an administrative notice that the inquiry's scope was being formally reviewed and that all parties were requested to refrain from further documentation submissions pending the review's completion. He read the notice in his office. He read it twice. The second time, he understood what the careful administrative language was actually communicating, and the specific understanding of a man who had managed his record across a long career and understood institutional signals with the fluency of someone whose career had depended on reading them correctly, settled into him with a weight that was entirely different from what he had expected this week to feel like. He had expected, by this point, that the inquiry would be moving forward on his timeline, that Voss would have received the formal notification, that the nursing board referral would be in preparation, that the specific leverage of a military inquiry's ability to reach a civilian credential would be doing what he had designed it to do. Instead, the inquiry's scope was under review, which meant someone had looked at what he submitted and found something to examine. He sat in his office for a long time after his aide left for the evening, and he thought about the signals log, which he had known existed and had calculated was either inaccessible or would not be consulted in a routine review. He had been wrong about one of those things, and the specific cold understanding of having made a miscalculation at a critical point settled into him without the option of revision. He picked up his phone. He had 3 calls he could make, 3 people whose proximity to this situation might provide him with information about how far the review had penetrated and what documentation it had reached. He made the first call. No answer. The second, straight to voicemail. The third call was answered, and the person who answered it said, before Draven could speak, "I was told not to take this call." The line went quiet for a moment. "Then why did you?" Draven said. "Because I wanted you to hear it from someone who knows you," the voice said. "They have the signals log, Marcus. They've already verified it. Whatever you thought you were doing, it's done." The call ended. Draven set the phone on his desk. He looked at the administrative notice, at the careful, neutral language of an institution beginning the formal process of examining one of its own. What he did not know, what he had no way of knowing because the information had not yet moved through the channels that would eventually carry it to him, was that Marchand's expanded authorization had already produced a preliminary finding in the records access review. And that preliminary finding showed that the third operation was not the only record he had accessed with a pattern inconsistent with his operational responsibilities. There were 4 others. 4 other operations. 4 other sets of decisions made on the ground by people who had been in the field while he had been on a screen. 4 other instances in which the documentary record had been visited and revisited across a period of years by an officer whose name should not have appeared in the access logs with that frequency. Marchand had the preliminary finding on her desk. At the same moment, Draven was sitting in his office with the noise of a collapsing calculation filling the space behind his eyes. She read it once. Then she picked up her phone and began the process of doing what the evidence required. And in Drentwood, in a house that was quiet in the specific way of a place where someone had chosen deliberate invisibility, Maren Voss sat at her kitchen table with the documents and her own memory and prepared the account of the mountain pass that she had carried for 3 years in a room inside herself that she had kept locked. She began to write, not with anger and not with the performance of vindication, but with the plain and specific accuracy of someone who had been there and knew what had happened and was, finally, ready to say it where it counted. Her phone buzzed. A text from a number she didn't have saved, which resolved when she opened it to a name she recognized. One of the 2 unit members who had refused to provide statements consistent with Draven's framing. The message was 4 words. "We're ready." "Are you?" She looked at the message for a moment. Then she looked at what she had written, at the signals log. At the medical authority protocol, with its clear, unambiguous language about exactly who held the decision in a communication blackout on the ground. She typed back 2 words. "I'm ready." She set them down and went back to writing. What she did not yet know, what would reach her in the morning with the particular force of information that changes the geometry of a situation entirely, was that Marchand's expanded inquiry had identified a 5th operation in Draven's access records, and the 5th operation was not one that Marin had been part of. It was one that Draven had, and the decisions made during that operation, and the way the record of those decisions had been managed in the years since, was going to make the 3rd operation look like a footnote. The 5th operation's records arrived in Marchand's expanded review at 11:22 p.m., pulled from an archive tier that required her new authorization level to access, and she sat with them through the night in the way she had sat with difficult documents before. Not quickly, not with the impatience of someone looking for confirmation, but with the methodical attention of someone who understood that what the document said mattered less than what they could prove. The 5th operation was designated in the archive as Cold Water. It had taken place 22 months before the 3rd operation, in a different theater, with a different unit composition. Draven had not been oversight command on Cold Water. He had been the operational lead. He had been on the ground. That was the first difference. The second difference was that Cold Water had produced a fatality. A single fatality among the unit personnel, a sergeant named Roland Vec, 28 years old, killed during the extraction phase of the operation. The official record listed the cause as enemy contact during withdrawal. Unavoidable combat loss. The paperwork was clean and signed and filed correctly. The third difference, which Marchand found at 1:40 in the morning, was that the medical report attached to Vec's death did not match the timeline of the operation as reconstructed from the signals log. The medical report said Vec died at 2217 hours. The signals log showed that the extraction vehicle carrying Vec's position had cleared the operational zone at 2209 hours, 8 minutes. 8 minutes in which, according to the official record, Roland Vec had died from enemy contact in a location the signals log indicated he was no longer in. Marchand set the documents side by side. She had spent 19 years in JAG work, and she had learned, across those years, that the most dangerous institutional lies were not the dramatic ones. The dramatic ones were findable. The dangerous ones were the small discrepancies, the 8 minutes, the omitted blackout, the access log entry that shouldn't be there. Because small discrepancies required the specific patience of someone willing to look at what nobody expected them to look at. She had looked. She picked up her phone at 1:47 a.m. and called her senior investigator, a man named Pratt, who answered on the second ring because she had told him 2 days ago to keep his phone available. "I need an independent forensic review of the Coldwater medical report," she said. "I need it compared against the signals log timestamp data and the field communications record, and I need the attending medic from that operation identified and located." It can take until morning," she said. "I need it by morning." Pratt was quiet for a moment. "This has gotten bigger than Voss." "Yes," Marchand said. "It has." She set the phone down and looked at the documents again. At the 8 minutes. At the name Roland Vec, who was 28 years old and whose family had been told one version of what happened to him, and who deserved, whatever else came of this, the accurate version. Marin had 3 hours of sleep when her phone rang at 6:45 in the morning. It was Marchand. "I need to tell you something before you come in for your formal statement," Marchand said. "The inquiry has expanded significantly overnight." Marin was sitting up in bed, already awake in the way she was always awake within seconds of a sound, the civilian adaptation she had never fully made. Draven. The inquiry now encompasses 5 operations, not 1. The 3rd operation, your operation, is no longer the primary focus. It is supporting documentation for a larger pattern. Marin was quiet. "Your formal statement is still needed," Marchand said, "but I want you to understand that what you're walking into this morning is not what it was when I called you yesterday afternoon. The board is meeting at 9. Draven has been formally notified that the inquiry's scope has changed and that he is now a subject of review rather than an initiating party." "He knows?" "His legal officer was notified at 6 a.m. Marin thought about Draven receiving that notification, about what it meant to be the person who had constructed something carefully over 14 months and then to receive, at 6 in the morning, the document that told you the construction had been examined. The fifth operation, she said. What was it? A pause. I can't share the details of an ongoing investigation with a witness, but I want you to know that the question you've been carrying, whether what you did in the mountain pass was the right call, the answer to that question is not in dispute from any party currently involved in this review. Marin let that land. Okay, she said. I'll see you at 9, Marchand said. She ended the call and sat on the edge of the bed in the early morning quiet of a house in Brentwood, and for the first time in 3 years she let herself think about the mountain pass without the specific emotional containment she had built around it. She thought about the 11 people, about the temperature and the darkness and the weight of the decision and the specific quality of clarity that had come over her in that 40-second window. Not calm exactly, but clarity. The narrowing of all the noise down to what the situation required and what she knew how to do. She had known, in that moment, that she was making the right call. She had known it the way she knew things that lived below the level of reasoning, in the body, in the accumulated knowledge of years of practice, in the part of a person that processed situations faster than conscious thought. She had known it, and she had acted on it, and 11 people were alive. She had spent 3 years managing the weight of that knowledge against a world that hadn't asked about it, against a hospital that had filed her under reliable, against a physician who had called her a tool. She got up, got dressed, and drove to the JAG offices in the Regional Command Building 40 minutes from Brentwood, and she gave her formal statement in a room with 3 people present, Marchand, a court reporter, and a recording device, and she told them everything. The timeline, the communication blackout, the casualties and their presentations, and the decisions she made in the sequence she made them, and the protocol that authorized each decision. She did not minimize. She did not perform certainty she didn't have. She said at 2 points in the statement that she could not be completely certain of a specific detail and named what she was uncertain about, because testimony built on overclaimed certainty was testimony that could be dismantled, and she had not come this far to be dismantled on details she could have said more carefully. It took 2 hours and 20 minutes. When it was done, Marchand looked at her across the table. Is there anything you want to add that the questions didn't cover? Marin thought about it. One thing, she said. I wanted on record that the decision to treat in place was not reluctant. It was not a breach that I recognized as a breach, and made anyway. It was the correct application of the authority I held at that moment, made with the information I had, for the outcome I was responsible for. I would make it again. Marchand wrote something on her notepad. Noted, she said. The board meeting at 9 convened with Draven present. He arrived with a legal officer, a young captain who carried the composed expression of someone who had reviewed the case file and understood its current trajectory. Draven himself looked like a man who had spent the preceding hours doing what Marin had done, which was sitting with a situation and understanding its shape, except that the shape Draven was understanding was the shape of something collapsing. He was 54 years old, and he had the bearing of a career that had produced that bearing deliberately. Straight, assured, the physical language of institutional authority, worn so long it had become indistinguishable from the person. But Marchand, when she looked at him across the board table, saw the effort in it, the maintenance that the bearing now required. Fassbender opened the meeting. He outlined the expanded scope. He did it in the flat, procedural language of a board proceeding, which stripped the human drama from it without removing the weight, and what remained was the sequence of findings, the signals log and the omitted blackout, the record's access history and its pattern, cold water, and the 8 minutes and the name Roland Veck. Draven's legal officer made 2 objections during the presentation. Both were noted, and both were overruled by Fassbender before Rice had to say anything. When Fassbender finished, he looked at Draven. Do you wish to make a statement? Draven's legal officer leaned over and said something brief. Draven listened. Then he looked at the board. I want to say, he said, and his voice was the voice of a man choosing each word with a care that was visible, that the inquiry I initiated was filed in good faith based on my assessment of the third operation. Fassbender waited. I am aware that the board's review has identified discrepancies in the documentation I submitted, Draven said. I am not in a position to account for those discrepancies at this time. The room held what that sentence meant, which was that a man who had spent 14 months constructing a case had arrived at a proceeding where the construction was exposed and was now declining to explain the construction. Rice spoke for the first time in the meeting. "Colonel Draven," she said, "the signals log for the third operation is system-generated and independently verified. It cannot be the product of error. The discrepancy between the log and your inquiry document is not a matter of interpretation." She paused. "The Coldwater medical report timestamps are similarly verifiable. The discrepancy between those timestamps and the signals log data is 8 minutes. She let the number sit. "I want to ask you directly, on record, whether you have an explanation for the Coldwater timestamp discrepancy." Draven looked at his legal officer. The legal officer said, "My client will not be making further statements at this time." Rice nodded. It was the nod of someone who had expected that answer and had asked the question anyway, because the refusal itself was information. Fassbender looked at Marchand. "The board's preliminary determination," Fassbender said, "is that the inquiry initiated by Colonel Draven against Nurse Maren Voss is not substantiated by the available evidence and is formally closed in the subject's favor. The records pertaining to the third operation will be reviewed and corrected to accurately reflect the field documentation." He paused. "Additionally, a formal investigation into the matters identified in the expanded scope review will be opened under separate authority. Colonel Draven is hereby placed on administrative leave pending the outcome of that investigation." The room was quiet. Draven sat with the news in the way people sat with the specific weight of something they had known was coming and found heavier than anticipated when it arrived. His legal officer was already writing. Marchand looked at the board, then at her notes, and said nothing, because there was nothing she needed to add. The documents had said what they said. The record had been read accurately. That was the job. Holt called Maren at 11:43 a.m. while she was driving back from the JAG offices. "It's done," he said. "Closed in your favor. I just got the notification." "I know," she said. "I was there." "You were in the building?" "I gave my statement this morning." A pause. "You didn't tell me you were going in today." "I didn't need backup, Holt." He was quiet for a moment. "No," he said. "You didn't." "Draven's on administrative leave," she said. "Yeah. And Coldwater is open now. That's going to take a while." "I know. Vec's family is going to find out the record was wrong." "Yes," Maren said. "They are." The road outside Drentwood ran flat and straight in the November light, the farmland on both sides brown and dormant, the kind of landscape that felt like it had been waiting for something without knowing what. She drove through it at a speed just under the limit and thought about Roland Vec, who was 28 years old and had died in a circumstance that had been recorded incorrectly by the person responsible for the recording. She had not known Vec. She had not been part of Coldwater. But she understood, with the specific understanding of someone who had spent years in the same institutional world, what it meant that his family had carried the wrong story. "The 2 unit members," she said, "the ones who refused Draven's framing." "Costas and Furlow," Holt said. "Yeah." "Are they okay?" "They're better than they were yesterday," he said. "The administrative review that had been opened on both of them, inquiring into their refusal to cooperate with Draven's inquiry, has been closed." "Good." "Maren," his voice shifted. "I want to ask you something." "Go ahead." "When you gave your statement this morning, did it go the way you needed it to?" She thought about the 2 hours and 20 minutes, about saying the mountain pass out loud in a room where it was being recorded, where it counted, about the specific sensation of that. Not relief exactly, because relief implied that something had been wrong and been corrected, and what she had said this morning was not a correction. It was the original truth, finally placed where it was supposed to have been placed 3 years ago. "Yes," she said. "It went the way it needed to." She was back at Callaway Regional that evening. Not because she was scheduled. She wasn't scheduled until the following week. She came back because the hospital was where she worked, and because she had found, over 3 years, that the work itself was the thing that organized the inside of her. Not the recognition or the title or the position, but the specific and repeatable act of showing up for the person in front of her. Prue was at the charge desk when she came in. Prue looked at her, read the day in her face. "Done?" she said. "Done," Maren said. "How done?" Closed in my favor. Draven's under a separate investigation now. Prue absorbed this with the contained satisfaction of someone who had known what the outcome should be and was glad to hear that it was. And you? I'm fine. That's not what I asked. Marin set her bag down behind the desk and looked at the department. The monitors, the bays, the familiar layout of a space she had spent 3 years learning to the point of reflex. I'm better than fine, she said. I think. I'm not sure I know exactly what that looks like yet. Prue nodded. That was an honest answer, and she treated it like one. Dr. Reyes appeared from the direction of the surgical suites, still in her OR scrubs, heading toward the break room. She saw Marin and changed direction. I heard, she said. News travels, Marin said. Okafor got the formal notification from the JAG office an hour ago. She forwarded it to department heads. Reyes looked at her with the direct attention of a surgeon who did not invest it unnecessarily. I want you to know that the statement I gave to the investigative division about your conduct during the surgical procedure on Castillo, about the remote consultation, about all of it, I gave it because it was accurate, not as a favor. I know, Marin said. I've been in a lot of ORs, Reyes said, with a lot of different people. What you brought into that room that night was not something you learn in a BSN program. No, Marin said. It's not. I'm not asking where it came from, Reyes said. I'm just telling you I saw it. She went to the break room. Marin stood at the charge desk for a moment with that, and then she did what she had come to do, which was pick up the chart on the top of the pending stack and go see her patient. Thomas Wick was moved from the monitored bed to a step-down room on the 3rd floor at the end of the week, which was faster than anyone had predicted and consistent with the pattern of someone who had spent years building the physical capacity for exactly this kind of recovery. He was awake and irritable, which Marin had learned to read as a reliable indicator of progress. She came to check on him on Thursday. He was sitting up in bed with the posture of someone whose body was healing faster than the hospital's movement restrictions wanted to allow. And when she came in, he looked at her with the assessment of someone who had been briefed. You're the reason I'm not dead, he said. You and Reyes and your own cardiovascular system, she said. Don't give me more than I did. Holt told me what you did, the whole night. Holt talks too much. Wick looked at her. He was 31, and he had the eyes of someone who had been in enough difficult places to have dropped the social reflexes that most people carried around. He didn't perform gratitude. He just said what he meant. I know who you are, he said. Not just last week, before. Then you know I'm a nurse who works the night shift at a 40-bed ER in a town most people drive through without slowing down. That's one version, he said. It's the accurate version, she said. It's the one I want. He held her gaze for a moment. Something passed between them that was not comfortable and was not uncomfortable. The recognition between two people who had been in the same category of places and understood something about each other that didn't require articulation. Okay, he said. But I'm still telling everyone what you did. That's your business, she said, and checked his chart and adjusted his pain management and told him the step-down criteria and left him to his irritability. In the hallway outside his room, she stood for a moment longer than she expected to. She thought about the 3 years, about the deliberate invisibility, the faded scrubs and the pulled-back hair and the careful business of being someone nobody looked at twice. She had built that life with intention. She had wanted the quiet. She had wanted the distance from the weight of what she had carried. What she understood now, standing in a hospital hallway on a Thursday morning, was that the quiet and the distance were not the same thing as the work. The work was the same. It had always been the same. The specific and repeatable act of showing up for the person in front of her, with everything she knew and everything she had learned and everything that 3 years in the military and 3 years in this ER had built into her. That was not something she had left behind when she chose the quiet. She had brought it with her. The visibility, the helicopters, and the inquiry and the formal statement in the room where it counted, that was not what defined it. The work defined it. The work had always defined it. She walked back toward the ER. Castillo was transferred to a military medical facility 2 weeks after his surgery, which was the appropriate next step in his care and which Marin had expected. Before the transfer, his unit had him in a wheelchair. Against the physical therapist's specific recommendation, which he ignored with the cheerful disregard of someone who had decided the recommendation was advisory. And he came to the ER. He asked for Marin by name. She was in the middle of a medication reconciliation when the ward clerk told her, and she set it aside and went out to the waiting area. He was 26, dark-haired, with the particular look of someone who had been through the specific version of fear that a closed head injury produced in the people who survived it. A look that was not quite the same as before, not worse exactly, but altered. Present in a way that suggested he understood something about the present that he had not previously. "I was told you talked Ortega through it," he said. "Ortega did most of it," she said. "I just described the steps." "Ortega said you sounded like you'd done it in the dark, in worse conditions, with less equipment, more than once." "Ortega is perceptive," she said. Castillo looked at her. "He said you told him that Irritable is alive." "That's accurate." "I want you to know I'm extremely irritable," he said. "That's the best news I've heard all week," she said. He laughed, a real laugh, slightly surprised by itself. The kind of sound a person made when the act of laughing still felt like it belonged to a version of themselves they weren't sure they'd get back. He looked at her after it with an expression that had moved past gratitude into something more complicated. The expression of someone trying to hold two things at once. The fact of still being here, and the understanding of how close not being here had been. "Thank you," he said. "Come back in better circumstances," she said. "Trying to," he said, and meant it in a way that had nothing to do with military operations. Okafor called Marin into her office 3 weeks after the inquiry closed. The office had the same settled quality it always had, the same desk, the same chair arrangement, the same woman behind the desk, who ran the nursing operations of Callaway Regional with precision and without drama. But the meeting had a different quality than the meeting 3 weeks before, because the information in the room was different. "I want to talk to you about a position," Okafor said. Marin waited. "We're establishing a clinical response protocol review committee," Okafor said. "The purpose is to evaluate our mass casualty and trauma response procedures and identify structural gaps. We had several identified during the highway accident event that coincided with the military casualties." She looked at Marin directly. "I want you to chair it." "I'm a staff nurse," Marin said. "You're the person in this building who has the most direct experience with the gaps," Okafor said. "The degree on the wall and the title don't tell me anything about that. Your record does." Marin sat with this for a moment. "What does it involve?" "Monthly committee meetings, case review, protocol drafting, coordination with the medical staff, including the physician staff." A pause. "Dr. Falk has already indicated he's willing to participate." "He has?" "He requested to be included, actually." Marin absorbed this. "That's unexpected." "I thought so too," Okafor said. "But I checked his recent case documentation, and his incident rates have dropped in the past month. He's been consulting with nursing staff more frequently. Something changed." Something had changed. Marin knew what it was, approximately. She had watched it happen in real time, in the trajectory of one bad night. She didn't have a clean narrative for it. She was not in the business of clean narratives about human behavior, which was messier than narratives allowed for. But she had watched him stand in that corridor outside the OR and wait. And she had read something genuine in the waiting. People were not simple. Neither was the process of revision. "I'll take the position," she said. Okafor nodded. "Good." She picked up a document. "There's one more thing. Brigadier General Marchand's office has requested that Callaway Regional's account of the events of that evening be formally submitted as supplementary documentation in the Coldwater investigation. I've drafted a formal institutional statement. I wanted your approval before I submitted it." She slid the document across the desk. Marin read it. It was 2 pages, precise and specific. The institutional version of what had happened in the ER that night. The medical decisions, the outcomes, the witnesses, the clinical record. It did not editorialize. It did not advocate. It described what had occurred. "It's accurate," Marin said. "I know it's accurate," Okafor said. "I wrote it from the documentation. I'm asking if there's anything you want to add." Marin thought about it. She read the second page again. "No," she said. "This is enough. This is what happened." She slid it back. The Coldwater investigation produced its findings 4 months later. The findings were not released publicly in their full form. Military investigations rarely were. But the summary determination was entered into the official record, and it was not ambiguous. The medical report attached to Sergeant Roland Veck's death had been filed with falsified timestamps. The falsification obscured the circumstances of the death and the decisions made in those 8 minutes. The falsification had been perpetuated across the records for over 4 years. Colonel Marcus Draven was formally charged. The charges were multiple and serious, and the military judicial process that followed them was slow in the way that institutional accountability was often slow, grinding, procedural, resistant to the impatience of people who wanted resolution faster than the machinery allowed. But it moved. That was the thing about the machinery when it was working correctly. It was slow, but it moved, and the direction it moved was toward the evidence. And the evidence in Draven's case was documented and authenticated and verified, and could not be revised by someone with access to an archive. Veck's family was notified. The notification was not an easy thing. There was no version of it that was. A family that had carried one story for 4 years was given a different story, and the different story did not make the loss smaller. It made the loss the shape it had always been, while the wrong version had been covering it. Maren heard about the notification through Holt, who heard it from the investigative office. She sat with the information for a long time. She had not known Veck. She had not been there. But the mountain pass and Coldwater were part of the same system, and the system was one she had been inside. And the people in it were people she understood in the way you understood people who had done the same category of things in the same category of places, even without knowing them directly. She thought about what it cost to be Roland Veck's family, to have carried the wrong story and then to be told the true one. She thought about what it meant that telling the true one required the specific and accidental chain of events that had led from a shift reassignment and an incident report to 3 helicopters in a parking lot in Brentwood and a formal statement in a JAG office at 9 in the morning. Accountability did not arrive cleanly. It arrived through the accumulation of people who did not stay quiet when they saw what they saw. Ortega, who managed 2 casualties in the dark with a phone light and a 14-gauge angiocath and did not freeze. Holt, who came to Callaway Regional not only because Wick needed her, but because he understood that the machinery needed to be set in motion. Costas and Furlos, who looked at Draven's framing and said no. Marchand, who read the signals log at 2 in the morning with the patience of someone who had spent 19 years understanding that small discrepancies were where the truth lived. And Maren herself, who had spent 3 years making herself invisible and discovered that visibility, when it came, was not something she needed to fear. She was not the hero of a story. She was a person who had done her job correctly in a mountain pass with 11 people bleeding, and had then done her job correctly in a 40-bed ER in a town most people drove through without slowing down. The circumstances were different. The job was the same. That was the thing that none of the drama around her could make complicated, because it wasn't complicated. You showed up. You used what you knew. You stayed with the person in front of you. The rest of it, the inquiry, the helicopters, the formal statement, the colonel whose constructed narrative had eventually been read against the evidence and found false, that was the world responding to the work, not the other way around. 6 months after the night the helicopters landed, Callaway Regional's ER ran a mass casualty drill. It was Maren's first protocol exercise as chair of the Clinical Response Committee, and it was imperfect in the specific ways that first exercises were imperfect. The communication lag in Bay 3, the staging error that put the wrong equipment in the wrong position, the resident who froze for 40 seconds before someone redirected him and he found his footing. Maren documented all of it without judgment and without the performance of disappointment. After the debrief, Falk caught up with her in the corridor. Bay 3 communication lag, he said. I saw it, she said. It's a structural problem. The position of the workstation relative to the bay entrance. I know. I'm putting it in the protocol revision. He walked alongside her for a moment. The resident who froze. Hendricks. What about him? He recovered, Falk said. 40 seconds, and then he recovered. That's not nothing. Maren looked at him briefly. It was not the kind of observation she would have expected from him 3 months ago. No, she said. It's not nothing. I wanted to say, he started, then stopped. You've already said what needed to be said, she told him. I know. I want to say something different. He paused. Watching you run that debrief, the way you handled Hendricks, not embarrassing him, just redirecting. I've been doing this for 12 years and I don't do it that way. You could learn, she said. I know, he said. I'm trying. It was not a resolution. It was not the end of a complicated dynamic between two people who had started from different positions and were, slowly and imperfectly, finding a working relationship. But it was honest, and it was movement. And Marin had learned long ago that movement was the most you could reliably expect from human beings. Not transformation, not the clean arc of a changed person, but the incremental and effortful, and frequently backsliding process of someone trying to do better than they did last time. She accepted it for what it was. The evening after the drill, she drove out to the stretch of highway east of Drentwood where the accident had happened. The multi-vehicle collision that had brought the mass casualty event to the ER on the same night the helicopters came. She didn't know why she went. She just found herself driving in that direction after her shift, in the November dark, a full year from the night everything changed. The highway was ordinary, 4 lanes, median strip, the kind of road that looked like every other road. There was no marker there, no indication of what had happened on that stretch of asphalt a year ago. The road did not carry the events that had occurred on it. It was just a road. She sat in her car at the pull-off for a while and listened to the engine tick as it cooled. She thought about the people who had come through the ER that night, the highway accident patients who had been cared for and discharged or admitted and recovered, the 7 injured civilians who had been treated by a department under impossible load, by people who had done their best under conditions that required more than they had budgeted for. She thought about Tomas Wick, who was back in operational status, and who had sent her a text 3 weeks ago that said simply, "Still here." About Castillo, who was in a long-term rehabilitation program and who, according to Holt, was being aggressively irritable at the physical therapy staff, which everyone involved took as a positive sign. About Ortega, who had been recommended for a commendation and who had, in Holt's retelling, been embarrassed by the attention in the specific way of 23-year-olds who did not yet know how to receive acknowledgement for something they had done scared. About Roland Veck, who was not here, and whose family now knew the true shape of his absence. She thought about the mountain pass. She thought about it the way she had not allowed herself to think about it for 3 years. Completely. Without the containment, the full weight of it, and the full clarity of the decision, and the 11 people who had been there and were still here because she had done what she knew how to do. She was not sorry for a single second of it. She had never been sorry. What she had been for 3 years was alone with it, and alone with it in a way that had gradually become a kind of ongoing cost she was paying without fully accounting for. She was done paying that cost. She was done with the invisibility that had been protection and had also been, if she was being honest, in the dark of a car on the side of a highway east of Drentwood, a form of absence, a way of being present in her life while withholding herself from it. The helicopters had not found her. She had been there all along. It just took 3 Blackhawks in a parking lot at 10 p.m. in November to make the room around her adjust to the actual dimensions of who she was. She started the car. The road back to Drentwood was straight and flat and dark, and she drove it at a speed she didn't second guess. And ahead of her the lights of the town came up out of the dark the way towns did. Gradually, then all at once, ordinary and specific, and hers in the way that a place became yours when you chose to stay in it. She chose to stay. Not because she had nowhere else to go. Because she had decided, sometime in the past year, without quite registering the decision, that Callaway Regional Medical Center and its 40 beds and its older than the staff floors and its vending machines that ran out of everything useful by Wednesday was the place where she was doing the work she was built for. Not hiding. Working. The difference mattered. It had always mattered. She was just now in a position to say it clearly, to herself and to whoever needed to hear it. She pulled into the Callaway Regional parking lot at 9:47 p.m. and sat there for a moment before getting out. The ER entrance was lit up ahead of her, the familiar fluorescent spill of a place that ran through the night without stopping. Through the glass, she could see the charge desk and the corridor and the shapes of people moving. The night shift, 2 hours into it, doing what the night shift did. She got out of the car. She walked through the doors. Prue was at the desk. "You're not on tonight," Prue said. "I know," Marin said. "I just came to pick something up." She went to her locker and got the protocol revision document she had left behind after the debrief. And on the way back through the department, she stopped at the entrance to Trauma Bay 1 and looked at it for a moment. The lights, the equipment, the specific layout of a room she had worked in for 3 years. She had stood in the corner of this room and been called reliable. She had been right about every patient and been told to know her place. She had been reassigned and come back anyway because the situation required it. And the situation had been the first in a chain that led to a formal statement in a JAG office and a colonel's constructed narrative dismantled against a signals log. None of that had changed the work. The work was the work. It was the thing that mattered, and the thing that remained, and the thing that she would still be doing tomorrow and the day after, in the same scrubs, in the same department, for the same reason she had always done it. Because the person on the stretcher needed someone who showed up completely, not partially, not with the portion of herself she had decided was safe to bring. All of it. She had all of it to give. She tucked the document under her arm and walked back through the department and out into the parking lot and got in her car. The night was clear, cold, the specific cold of a year coming toward its end, and the stars over Drentwood were as visible as they ever got this close to a town, which was not entirely visible but enough. Enough to know they were there, enough to orient by, enough to matter. She drove home. She was not the nurse nobody noticed. She was not the quiet woman in the corner waiting for the world to catch up to who she was. She was Maren Voss, and she had made the right call in the mountain pass, and she had made the right call in Bay 1, and she would make the right call tomorrow in whatever version the work required, because that was who she was and had always been. The world had needed a crisis to see it. She had known it all along.